Adrienne Ann Breitfelder, City Clerk, you are hereby directed to call a special session of the City Council to be held on Thursday, March 3rd, 2022 at 6:30 p.m. in the historic Federal Building for the purpose of conducting public hearings on certain fiscal year 2023 department budgets.
Thank you. Good evening, and welcome to a special session of the Dubuque City Council for March 3rd, 2022. As a reminder to our participants, you can provide in-person input or virtual audio and written input during tonight's public hearings. Input options during the live meeting include: in-person attendees may approach the podium when the mayor asks if there is any public input for the public hearing they would like to speak to. Remote attendees can log into GoToMeeting using the login links, phone numbers, and access code that appear on the broadcast and live stream and posted on the front page of the meeting agenda. This option includes audio input and written chat input. If you are participating via computer, indicate which public hearing you would like to speak to in the chat function. If you are participating via phone, indicate that you would like to speak when phone lines are unmuted. All phone lines will be unmuted during each public hearing, and city staff will determine the speaking order of the participants. All comments, whether in person or virtual, must be accompanied by a name and address. Additionally, written public input is accepted by contacting the City Council directly from the city's webpage at www.cityofdubuque.org/councilcontacts and through the City Clerk's office email at ctyclerk@cityofdubuque.org. This information will be reiterated during the meeting. Attendance for the session is as follows: Mayor Kavanaugh.
Here.
Council members Farber.
Here.
Jones.
Here.
Resnick.
Here.
Roussel.
Here.
Sprank.
Here.
City Manager Van Milligan.
Here.
Thank you. We will start with our public hearings for fiscal year 2023 department budgets, and our first presentation tonight is Health Services.
All right. And I forgot to mention these last night for different departments, but I'm going to point that out before we get started, that the Health Services Department has 6 improvement packages requested and 6 recommended this year. So, Mary Rose, I'll turn it over to you.
Good evening, Mayor, City Council. I'm Mary Rose Corrigan, Public Health Specialist with the Health Services Department, here to give you our fiscal year 2023 budget presentation. So the mission of the Health Services Department has remained the same, which is to provide effective and equitable public health services to prevent the spread of disease and other health conditions while promoting the health, safety, and well-being of our citizens and the environment. We have 6.14 full-time equivalents, which includes myself, 2 environmental sanitarians, a confidential account clerk, 2 animal control officers, and a public health intern for usually part of the year. And here we all are, and this staff has been the same for the past 2 years. So highlights of the past year include FDA standardization of both environmental sanitarians, and this is necessary for the contract we have with the Department of Inspections and Appeals for food safety inspections, and which it also included quality assurance inspections. We secured a 3-year contract with the Iowa Department of Inspections and Appeals, which is the maximum contract they give to local communities. The Crescent Community Health Center added Quick Care Clinic. And as you've heard all year long, and we'll hear some additional information, the ongoing COVID-19 pandemic response and our ongoing incident management team planning and management. So in the next year or so, we're going to be looking at a number of initiatives, one of which is review the pet data contract and study in-house pet licensing system, and I'll go into detail in this in a little bit further in the presentation. We'll continue with the Iowa, the FDA food protection standards required for inspections. And brain health, as it is a city council priority, we'll continue to work on that, and we're going to be gathering the city staff who are most impacted by brain health and dealing with citizens who are affected by brain health issues and assessing what our needs and common responses are to determine how else we can effectively address this in the community. Crescent Community Health Center is going to expand wellness services, among a few other things. Obviously, we're going to continue to work on public health preparedness. The City Hall Annex and Health Department will be part of the city office space study. We will be renewing the Dubuque Regional Humane Society contract, which is up June 30th. We'll also have our Iowa Department of Public Health contract renewal for swimming pool inspections, and hopefully we'll get started on the Community Health Needs Assessment and Health Improvement Plan, which is a little overdue. So the pandemic has been a clear illustration of the Health Services Department response and the high value we provide to the community. I put our department and our county public health incident management team up against any pandemic public health response in the state. Our ability to leverage partnerships and collaborate with healthcare providers was significant and top-notch. And so I think you should agree that the City of Dubuque receives a large return on investment on the Health Services Department tax support dollars, which is $7.50 to the average homeowner's property tax. I'll talk a little bit about our equity plans and how we incorporate that into our daily work, but here are a few examples. We strive to prepare families and residents for emergencies, of families and residents of all backgrounds, and that was evident in this COVID emergency too. Last year, we had the animal control brochure, which explains all the rules and regulations translated into Spanish. We provided signage and educational materials in 3 languages for the COVID response, and we even held specific sessions for vulnerable populations and specific populations on vaccinations. One thing we were able to do also since the pandemic started is we got a credit card machine in our office, which enabled people to do business of paying licenses and fees by not having to come in, but it also created a major convenience factor in that many people just don't carry cash, have checks, those kinds of things. So that was a big impact too. Our environmental health activity has about 5 sections, broad sections, and they promote a safe and healthy environment by assuring safe and sanitary conditions and practices, and that includes all our food inspections of restaurants, grocery stores, temporary food stands, food trucks, different things like that. Swimming pool and spa inspections, public ones, tattoo parlor inspections, nuisance control, and of course, public health preparedness and response. They're intricately involved with that. So the food license revenue we receive by licensing, every establishment supports that activity, and these are how it has been going since FY 2016. In FY 2019, the state did increase those fees, and so the full year of that was seen in 2020. It remained fairly stable for the last 2 fiscal years. And this is our total number of food establishments that are licensed. I think one of the big increases in FY19 was we had a lot of temporary food licenses, and now those kinds of temporary food stands are able to get 1 license a year, not for each event. So that has cut down on the actual number of licenses. I need to show you this slide first. So every year we have a number of new establishments, change of ownership, and out of business. And this is how the new food establishments has tracked over the past few years. And it comes and goes. Sometimes establishments change names and type altogether, and sometimes they just change management. And this illustrates that also of the number of establishments that have gone out of business. And I wanted to show the effect of the pandemic on our local restaurants and food establishments. And basically, it kind of followed a downward trend in FY 20 and 21. It had been going up slightly. FY 20 is kind of the result of what happened the previous year. It went up, and then it went down a little bit again in 2021. We have rather limited data in FY19 on out of business. They don't always tell us. We just kind of find out when they don't renew a license. So, but basically, the number of establishments that has gone out of business has remained fairly steady the last couple of years, thankfully. And we also work on equity in our food service establishments because we have a variety of types, particularly from people of different ethnic and minority backgrounds or that serve that kind of food. All of our food service educational materials and regulations are in multiple languages, and that's provided by the state of Iowa. And we also have signage we can provide for workers who are non-English speaking. And just to give you an idea of the minority-owned businesses, which we worked with economic development to try and calculate, we currently have 41 food minority-owned facilities in the city, and 6 were new in FY21, and there's 3 new as of February 2022. As I mentioned earlier, the environmental sanitarians continue to work on these standards with FDA, and it's kind of a big deal because they make sure that the food inspectors are providing consistent and fair inspections, education to the operators, and that it provides consistency across the state in interpretation of the laws and regulations. They also do hotel inspections, swimming pool and spa inspections, tattoo parlor inspections. And unfortunately, one of the most common pool inspection violations is record keeping. We did receive a few grants to buy extra equipment from the FDA and the National Environmental Association of Food Protection and National Environmental Health Association. So they will provide temperature logging equipment that we can work with operators to make sure they're cooling or heating their foods properly, and more or less as an educational tool for them. Nuisance control is still a part of our department, and this involves things like excessive garbage, junk, and different kinds of things outlined in our nuisance ordinance. The interesting thing is in FY20 and 21, we responded to far fewer complaints than normal, and that's partly due to the pandemic, people kind of staying in place for a while and not being out in the community, seeing these kinds of things, reporting these kinds of things, but also because the Housing Services Department also covered a lot for us in responding to those complaints. And in fact, they ended up they now do all the vegetative and weed overgrowth complaints. But so far, in FY22, this year, we've already had 106 complaints through just February 22nd. So that is a little bit alarming, and they are significantly and very much verified complaints. So oftentimes, we have to hire a contractor to clean up these nuisances if the owner is unable to do so or they're non-responsive. And this is how that's shaken out. Again, we did very little of that in FY20 and FY21, and already this year we're seeing some of that in an increase. And it results in costs which we end up assessing back to the property owner. So moving on to animal control. We can see that the last couple of years, the complaints and requests for service have remained fairly steady, and this shows the ones that our animal control officers do, and when they are not on duty, the police department does it. So together, they do quite a few complaints every day of the week for animal controls, and they address also animal bites during that time. Any loose or stray animals are impounded at the Dubuque Regional Humane Society. Some are brought in by the public, the police bring some in, and our animal control officers bring some in also. So as I mentioned, we'll be redoing that, updating that contract with the Humane Society here in June for us to be able to do that. So the pet licenses sold, this is the number of dog and cat licenses sold, and you can see a rather large increase from 20 to 21. 878 more. This is partly due to our ease in purchasing licenses through having credit card purchases, and also our efficiency in bringing everyone up to date, and probably also because more people were adopting pets during the pandemic. This also resulted in a substantial increase, 21% increase in revenue for the for the pet license revenue, and our confidential account clerk, Connie Mueller, is excellent at customer service and working with people and texting people, and it's amazing what brings people in to get up to date on these kinds of issues. So in fact, we polled city employees, a few of them, to see who got new pets during the pandemic. And this is what we found, and a couple of you participated in this. So a lot of new furry friends, and I know they provided good companionship during the last couple years. And one of the biggest things animal control responds to is animal bites. We also try to prevent that. In FY19 and FY20, we saw a pretty substantial increase in the number of bites. We were very concerned about that, quite frankly. It went down in 2021, probably a lot due to the pandemic and people staying home more. So hopefully that trend will continue. They also do cruelty and neglect investigations in conjunction with the police department and our legal department. Unfortunately, those have also risen. We have kind of standard operating procedures for animals left in vehicles in bad weather, and these are very time-consuming things that we deal with. So in enforcement, we do a big part of that is in keeping people licensed with their animals. And basically, the main reason for that is to assure that their rabies vaccinations are up to date. That kind of tailed off in FY20 and 21. Enforcement was not a top priority back then, and we tried to work with people as much as we could. So we issued less citations. It did result in the revenue going up, however. Other citations are for other violations that can't be solved through cooperation and education that violate the animal control ordinance. Animal control also occasionally gets wild animal requests for service, and this is when there's a wild animal that's injured, sick, or causing a nuisance, and they will help deal with that, often in conjunction with the police department, the fire department, Public Works, whoever happens to be able to help rescue animals. And also trapping animals, mainly nuisance and feral cats. That kind of went back up this year as animal control was able to get back out. And you may be wondering about pets in parks complaints, since this is before and after we started allowing pets in the parks due to the pet-friendly task force and your change in the ordinance. Very few complaints, quite frankly, only 9 in FY21. And so I think that's a good sign. People are mostly following the rules. We don't have a lot of problems with that we are aware of. So that's a good sign. So one of the things you all have talked about in the last couple of years is our pet licensing system, and we have a contract with a company called Pet Data that sends reminders, issues pet licenses, takes payments for our licensing system, and that's been in place since about 2010, maybe, something like that. It's not perfect, and we thought that with the new ERP software through Tyler, they do have a pet licensing module. So one of the things we want to do is this fall, after the process for getting everything else organized is well underway, we're going to take a look at that pet licensing module, see what it has to offer, and then at the same time, we may issue an RFP to see if there are other vendors or places we could outsource that service so we can have a comparison on which would be better, and be able to evaluate in-house versus contracting for those kinds of issues. So the goal is to have an idea of costs for whatever recommendation we come up with for the next year's budget. We would be able to implement then at the start or during the FY23 fiscal year. One thing I haven't talked about in a couple of years is our urban deer management plan. This has been going on since 2008, and every year I put the results up of the harvest for the past several years. But basically, this is done by local deer hunters who help keep our deer population at bay at a healthy level and to hopefully prevent some of the nuisances and safety concerns they can cause in traffic and those kinds of things. So we continue with this. Again, a big help with the my confidential account clerk and other staff also help with this program, and the Iowa Department of Natural Resources Wildlife Management. So although I could probably give you a whole presentation on Crescent Community Health Center, I wanted to give a quick update. We do have contracted services with them, and they're doing just a fabulous job. They clearly address equity in our community in terms of health and social determinants of health. Last year, they expanded into behavioral health, and this year added a quick care clinic on the first floor. So they're quickly filling up the building, the MedX building down on Elm Street, except for a couple other partners of pharmacy and the physical therapy business. But very proud of them, and you should all be very proud of having this as a priority for many years. So this is how the number of patients at Crescent has increased. And about 2019, HRSA, the federal agency that funds and regulates community health centers, set Crescent's projected patient population goal at 8,057 for 2020. So back in 2019, I thought, wow, this is a big jump from 6,400 to over 8,000. We're never going to have that many patients. Well, we didn't achieve that in 2020, but there was quite a few reasons for that with the pandemic. But as you can see, this year, we're over 8,200. And this 8,200 also includes 4,800 virtual patients who were able to do telehealth in 2021, and actually that started in 2020. So again, providing broader outreach to patients, moving with the community needs. So this 8,216 patients seen in 2021 produced over 29,000 patient visits. And addressing one of the community health needs and a city council priority on brain health, Crescent has added that in the past couple years. They have psychiatric medication management and therapy, and they also have a couple different kinds of therapy, medication-assisted treatment for opioid and alcohol use disorders. They just are expanding that all the time and seeing increased patients every year. So a little bit about how COVID has impacted us. This is just a snapshot of a couple revenue sources of where our budget is, and this time of year, each year for the past 3 years. Our food license revenue is based on total gross sales of the restaurants. So if they're doing less sales, they're going to have to pay a lesser license fee. This could explain, the dip right here from February 20 to February 2021. And we'll see, hopefully, if this comes back, mostly so the restaurants can bounce back. Our animal license revenue, however, like I said, increased. And we were able to focus on providing individual service to catch people up from delinquent licenses and help them through the process, encourage them to get their pets spayed and neutered so they can get a cheaper license, all those kinds of things. As mentioned, we've got a few improvement packages requested, some things like a standing desk for our account clerk, some overtime hours funding for environmental sanitarians and animal control. Environmental sanitarians often have to do work in the evenings or on weekends for festivals and other things that come up. And animal control sometimes works holidays and has unforeseen issues sometimes they have to deal with. We're also going to, we'd like to fund the National Environmental Health Association credentialing exam for a new sanitarian, and the Leadership Dubuque program for her also. And we We work in conjunction with the Housing Services Department on our lead poisoning prevention program. And when there's a lead poisoned child, the Housing Department does a lead inspection, primarily because they're doing these all the time, they have the equipment. But sometimes if that person or that family doesn't end up participating in one of the HUD lead grant programs, we need to pay for that service somehow, because it technically can't be covered by the HUD lead grant. So we need a few dollars to cover those lead poison inspections when they don't end up being part of the HUD grant. And that's what that last improvement package is for. So I would just like, I know you've been hearing from me for 2 years at every single council meeting, and most recently monthly since October, providing COVID updates. But just to summarize it all, I'd like to spend a little time on that here. You know, first of all, it's a pandemic of a lifetime. I don't know if we can compare it to the great influenza in 2018, 2019. None of us were around, but in our lifetime, it's pretty much it, and it's going to take a lot to pass this one up. So basically, what's the day in the life of a public health worker and myself during a pandemic? So every day, start off by looking at CDC updates, guidance, and their COVID data. We have to make sure we're keeping up with all their changes and guidance and recommendations and vaccinations and all those things. We looked at White House briefings. We looked at our own public health data website with the Iowa Department of Public Health for COVID cases, the amount of testing going on, vaccine administration, deaths, and other kinds of rates. We also followed the Iowa Department of Public Health website and their guidance for data and other indicators and direction, along with many other favorite news and other websites we found had good information. As I mentioned, we did a lot of city council presentations. So basically what we did boils down into prevention, contact tracing, and investigation, which was primarily done by our wonderful public health nursing partner, VNA. Provided COVID-19 testing and assurance that that testing was available in a variety of ways. We helped you and the Board of Health and Board of Supervisors with mask policies. Vaccinations, of course, was a big part of the response. Treatment, which is now available and requires coordination for dissemination of the drugs. And quite a bit of time on the potential OSHA vaccination mandate, which didn't end up happening, but we did a lot of planning and assisted other people in the community to plan for that. I remember this slide. This is the overview version of the algorithm for distributing the vaccines. And that's how it started out. And that was a big project. We got it done. We had great participation in the community and a lot of providers. No turf issues here. We did education, information, and provided guidance. And I can't tell you what a help our public information office was. I don't think any other health department had access to a public information officer and their entire department the way we did. You know, we gave them information, they produced handouts like that's on the slides. They assured us that signage was provided, that we had daily updates for a long time, that we would email, send to the media, anybody that signed up for them. We did media releases. We addressed, they filtered and helped funnel media requests from TV, newspaper, magazines, radio. They helped us prepare for those. They did mail-outs, handouts, billboards. It was phenomenal and it was a great partnership, and they were in on many of our meetings. We also did weekly presentations and meetings with long-term care facilities, vaccine providers, hospitals, all the school districts in the county, higher education institutions in the county, testing providers, and often city employees, and that was weekly. So every one of those got a presentation, update on data, new guidance, and answered questions. We had a lot of meetings with the Iowa Department of Public Health, virtually, of course. And then other kinds of things we did, we worked quite extensively with Greater Dubuque Development Corporation and the Chamber on vaccination for employers and work sites and their people. The Equity Immersion Committee was phenomenal in helping us reach our vulnerable populations, getting them testing, vaccination, treatment, housing. They were phenomenal. Our housing department worked with us in providing information to shelters and then helped manage our quarantine and isolation shelter. We worked with fire, police, and sheriff departments for their own staff safety and response. And we even helped get out door-to-door vaccination outreach through a lot of city employees doing knocking on doors and handing out information. So those are just some of the highlights of things we did, but we didn't do it all. We had a network of all different departments, community, businesses, agencies, and that's the way incident management is supposed to work. So now what? So what's next for public health? Well, we have some catching up to do. We have food inspections that we're behind on. Hope to get started on an update of the community health needs assessment. Get back into our regular pet license enforcement. I'm a little bit behind on some administrative duties like performance evaluations, and we want to get back into our staff doing their education and training, and get back more involved in our Lead and Healthy Homes program, particularly in case management of kids, families, and community education. So what's next? So one thing we have to do is continually improve our public health capabilities and update and revise our plans. This was updated in 2017. This is our public health preparedness and emergency response plans. Was this helpful? You bet it was, because by making these plans, we had already established a lot of partnerships. Now we have a lot of lessons learned, so we have some updating to do. I know there's hopefully going to be grants and funding available for a lot of these things, and training and education for staff, and more exercises and drills. And one other thing that we can't forget is the impact on public health. The University of Iowa College of Public Health devoted an entire issue of their magazine, Insight, to the effects of the pandemic on public health workers. And I can say that many of the things cited in this issue are reflected in our staff, our incident management team staff, not only on workload, being resilient and nimble, but on our mood, our physical, and our brain health. And I continue to stress balance, healthy lifestyles, and time off work when possible. So hopefully we will bounce back, and the pandemic will continue to decrease and become endemic and not a pandemic. And just to say, we do have a little fun along the way on Halloween, or whatever the case may be, to help with staff and team building, getting along, and everything else. So that's the end of my presentation, and I'd be happy to answer any questions you have.
All right, thank you very much, Mary Rose. Before we open for public comment, I just want to make a comment on my own. I didn't know they made binders that large. I actually didn't even know that existed. So, Adrian, if we could open for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, do we have anyone in person with some public comments on this particular hearing? Okay, seeing none. Anybody virtually?
No virtual input.
Okay, I'll bring it back to the table for any discussion.
Mr. Mayor.
Yeah, Ms. Farber.
So Mary Rose, kudos to you and your team. Just an awesome energy, enthusiasm, and outstanding results. And I don't think the community could have worked through this pandemic without your help. So that's just a big thank you. And in appreciation for your first improvement package, I would like to talk about that and actually put an additional thought for us to consider, and also, Mr. Mayor, something for us to perhaps put aside for discussion about more budget funding for this work package. And that is, as you know, owning a restaurant and a mobile food unit. For the last 7 years, I've worked very closely with Tim Link and Katie and now Sydney. And as I have been working with them over the past few years, especially when we do festivals, we have venues where the food trucks are out and about, and they are scurrying out and about trying to make sure that the public is safe and there aren't cross-contaminations floating around, things like that, as we are enjoying these events. And I find that perhaps it would behoove us to take a look at maybe increasing this to a half-time personnel position rather than just 40 hours of additional overtime. Because I see them coming into our facility or into our truck very, very stressed, very, very tired. And before the events occur, they have to be with us as we are settling into a market or settling into a festival, if you will, and there may be going forward, not just 4 or 5 mobile units, but as the pandemic is decreasing and more opportunities and venues arise in our different city areas, there are going to be many, many more facilities that they're going to have to inspect. And I look up to them, we counsel with them on every move that we make at our restaurant. And I just know they're stressed. I know that very similar to some of the other employees in your group, there's just a lot of activities that they rise up and take care of it for us. But I do know that, they're overworked. And I think maybe some additional staffing could be perhaps to benefit the team and also benefit their entire attitude toward work and stuff. And I know as Tim is progressing in his status with this as well, it will be time as well to add additional staff. So I am asking for perhaps some conversation about that and perhaps helping there with either a half-time or if you think it should be a full-time employee.
Mary Rose, I'll kick that to you first if you don't mind. I'd love to hear your comments on it.
Well, keeping up with the pace and the required number of food inspections and the frequency of food inspections is a challenge, especially considering all the moving parts, change of ownerships, new establishments, which take a lot more time. Because, we work with new owners and establishments extensively to make sure they get off on the right foot. So that's a lot more than one inspection. And then it doesn't take much to suck the time away from the environmental health workers. The pandemic was a clear example of that, but any other kind of emergency, flood, weather-related thing that we help with clearly takes them away from their regular duties, and then they're behind again. The state's been understanding in that with our contracts, but we don't like to have a restaurant go longer than they should between inspections. And so, yes, it's clearly something that could provide added service, more timely service, and probably better service. The outdoor festivals, and there's a lot of new vendors every year for that need a lot of education, and it takes time to help them prepare for those things. So adding a person would provide flexibility when other things come up, when they're behind, to get caught up, all those kinds of things, and provide more timely service. So I couldn't agree with you more.
Thank you. Yeah, I just see the stress, and I appreciate all that they do, and I'm so pleased that they think of us as their buddies, and that we try to support them as much as we can by making their jobs really simple when they come and visit with us. So, thank you, Mr. Mayor. Thank you.
I'll ask a question then to that. Thank you, Ms. Farber. Can you just clearly tell us what is the cost for, if we were to have another full-time environmental sanitarian, what's the?
Jenny's giving it some tally
Yep,
in
I
here.
figured I was probably throwing that one at Jenny.
That's not in my head right now.
Yeah, that's okay.
In round numbers, it's about 92,000.
Jenny said another full-time person would be 92,000 all in, probably, right?
With benefits.
One more quick question, if you don't mind, then. Ms. Farber suggested a half-time person. Is that a real possibility in a situation like this? I mean, would a half-time environmental sanitarian be able to exist within your department?
Well, there's a couple factors. Number one, the employment market right now is challenging, and everybody's competing for employees. The amount of kind of training and somewhat credentialing you have to do these inspections is pretty significant. And, you know, like I said, a lot of it's virtual and online, but you do have to have a public health or science background in order to understand all that. And it can be learned, but there is a significant amount of training. And so if a part-time person filled that role, that would eat up a little bit of their time getting started naturally, but the turnover of part-time people is more frequent, and moving on to other city positions, that thing. So that investment in training would be, we'd have to roll that into the position and the time they have, you know. So that may be an issue.
Okay.
So, you know, you don't know that till you test the market. But
Okay, thank you.
I know the last time we hired for this position, which was, you know, we started the process about 2.5 years ago, right before the pandemic, and the amount of applicants was not overwhelming at that time, I'll have to say. We got a pretty decent pool, but it was not large.
Okay, thank you. Bring back to the table then for any other comments here. Yeah, Mr. Spring.
Thank you, Mr. Mayor. I see the need for it. I was hoping it wouldn't cost as much, but it is what it is. I understand that because I've been to major cities where there's food festivals, and sometimes there's things that just go way sideways, and all of a sudden there's a whole bunch of people that have stomach viruses and things like that. Luckily, hopefully, we haven't had anything like that, but we do seem to have more and more food trucks coming into at these festivals that we're having. There seems to be a couple new ones every year. Maybe there's a happy medium that we could reach where maybe there's you host a training, like you get them all together and we do a special one-time event training or something. And I don't know, I just don't want to get a bunch of people sick either off of something, but I get what's going on. If going back to a little bit on your presentation, Mary Rose, how much time would you quantitatively say you put in for the whole pandemic? Just ballpark it. And I'm sure Gus can be like, oh, just if you had to just put a number in, just would you say more than 80 hours a week?
Well, in the beginning, it was definitely 7 days a week, and pretty much, you know, full days. So, yeah, you know, for a while there, it probably was. After we got in the groove and got better, you know, the hours each day probably lessened, but we were still kind of 7 days a week for a long time. And then still always on red alert, you know. But I'd have to do some number crunching. But yeah, it was a lot. And, you know, the staff was the same. I called on them a lot, you know. Way too many people have my cell phone number now, too. So, but our whole incident management team did that. You know, we don't have any, we all had to work a lot. We don't have really backup for that. So the numbers of hours, yeah, it was a lot. But you had to, because things could not wait, because changes were happening, people needed answers. You know, vaccine was coming. Just when you thought things were going good, there was a change in a rule, a law. Oh, you know, this is coming tomorrow, whatever. And so you could not put things off, which is why the days got long sometimes.
Well, thank you.
Mr. Mayor.
Yeah, Mr. Reza.
Thank you. Thank you for your presentation. So much great work, and I'm glad that you were honored and really pointed out as for all your great work. I know you're just the head of the team, you would say, but you personally, of course, did so much great things. And I love how you were very forceful. You are generally like to kind of downplay all the great work you do, but today you were like, citizens are getting a great deal. And you know, I loved it because that's absolutely true. So my question, first of all, about the latest question here is, it's pretty rare we improve the improvement package. I mean, generally, if it's needed, it's requested, and then it goes through regular order through Mr. Van Milligan. And he looks at it and decides where it fits, especially with these significant expenditures that were talked about here. So also, it's generally, we don't just spitball at the council about what's needed and what's not needed, and maybe a little bit more money here and there. So it's just irregular. No, that doesn't mean it's bad. The other thing that I'd be looking at is if you're going to suggest that, then where is the offset? So I think it's just good discipline for the council to identify an offset for this suggestion of spending more taxpayer money. And there's a lot of great reasons to spend money, and Mr. Van Milligan, regular order, has gone through all those. So that's what causes me pause with this. And I do have a question for Ms. Larson, if you don't mind. And that would be, I noticed that I know that we have a 3.25 increase in wages, and we have a 6.7% increase in employee expense. And so I went through there's more, there's benefits, et cetera. So is there an approximate monetary equivalent for benefits that we could say across the department? So I don't have to ask all the time about individual things. I could say, well, in general, promotions and benefits account for an additional 2%. So if I see 5.25%, that's just pretty much on target? Or is there a way that we could approximate that, or not really?
We could take the healthcare costs and just extrapolate that across a cost of an employee, right?
Right.
You know off the top of your head what our single person, or what our percent increase was in healthcare costs?
Yeah, it's
It mentioned 3.3% higher.
3% increase
Right.
for the city contract rate.
And you remember about what it is per employee? Is it like $12,000? Well, it depends. We average it because some have family plans and some.
That would be their contribution though, so the 3% increase is the city's cost.
Right. We could try and calculate that, don't you think? Yeah, we could for the next meeting.
I know that there's more than salary. It'd be interesting, maybe it's just too much work to say, well, this is salary, this is promotion, this is benefits, and then we could see where it all comes from. The aggregate of 6.7%. I mean, I did read that, and this specific, it just led me to general questions if something can be generally said to be a certain percentage. If that's not possible because, 700, 800 employees in all these departments, maybe that's not possible.
I think it'd be easier for us to do the healthcare thing, but the change in their grades and things, that would be almost impossible because some departments have a lot of employees that change pay grades in a year and some have very few. So that would be, I don't think we could do that.
All right, thank you. That would help me in across the board with these 6 meetings or so, 7. Thank you, Mr. Mayor.
Okay, so other comments, we do have still a specific proposal from Ms. Farber to potentially look at either a half-time or full-time position. We have some information about that, so that is on the table here to be able to discuss. I just want to hear from other folks about anything along those lines or any other piece. But yeah, Ms. Rousseau.
Well, I think certainly employees would like to have additional help in their department, but I think the comment that Mary Rose made about the difficulty in getting a part-time employee with those proper qualifications would really be a challenge.
Okay.
Mr. Mayor?
Yeah. Mike.
I guess I would like to make a supportive comment to that. So I'm not making any judgment about the idea of whether an employee should be added or not. That's for you to discuss, but the idea of part-time versus full-time. So just to remind you, what we're doing in the budget. For instance, in our 911 public safety dispatchers, we're reducing the number of part-time people and increasing the number of full-time people, because in this environment, it's just a super struggle to hire people in a position that requires some level of technical skills and training, and then we lose them so fast. And we're doing the same thing in our bus system. So we're reducing the number of part-time drivers for our, it's not called dial-a-ride, but it's not the fixed route service.
Minibus.
Minibus, I'm sorry. For the minibus service, and increasing the number of full-time positions, and it's the same thing. So I guess I would ask you to consider, if you are gonna consider more staffing in that department, it's probably more realistic that it would be a full-time position and not a part-time position. Because I think even if we could find somebody, keeping them after we train them, it'll just become a revolving circle where it won't really ever contribute to staffing.
Mr. Mayor?
Actually, before you go again, Ms. Farber, Mr. Jones, do you have any comments on this? I don't mean to put you on the spot. I just wanted to give you a chance before Ms. Farber.
I would certainly add it to the list for further discussion, and the question of offset, I think, comes at the same time as that discussion happens, because we've got a number of these evenings yet to happen.
Yeah.
Where we'll learn about the priorities of the other departments, and maybe we'll find an offset that makes us want to do this. Maybe we'll be compelled to want to do it without an offset. Maybe we'll decide next year would be better. But having it on a list for further consideration is certainly worthy at this point.
Okay. And before I give the floor back to you, I'm gonna just mention, you know, I think there is an urge to try and help in this way, you know, every year. The challenge that we face here is that we very quickly, on night number 2, for example, end up on a pretty slippery slope of really, because Mr. Resnick's right, you know, this has gone through a funneling process to get to us first. And it doesn't mean that we can't do what you're suggesting, Ms. Farber, and it sounds like we have some support at the table for that. But what I would ask us to consider and be cautious about is if we start to do this now, then the chances of adding more positions and taking away other things, and you know, we start to move a lot of pieces over the next 6 nights. And that's not to say that we shouldn't if we think it's a good idea, but it is to say that it's a caution that I would suggest. And plus, you know, not that the time we spend here isn't important, but just to point out, you know, when we do this, it also leads to discussion being longer. We're on our first presentation of the night. We're already an hour in, and that's, you know, part of the challenge that we have here. So I'm not shooting it down, but I just wanted to point those things out as we talk about it. So I'll give you the floor back
With
here.
all due respect, and I totally agree and understand that process, and very much respect what has been done by Mike and the team, and Mary Rose's team as well. Just a quick question for Mike here. Is it possible to look at, as we're looking at potential decisions here for increases or decreases or offsets, to look at some additional funding from other sources, whether it be ARPA or some of the other grants that might be available for public health and safety?
Well,
I mean, to explore. I'm not saying you have to answer that now, but with that.
So I'll give a process answer and then a little bit of in the weeds answer. So when the council sets something aside for discussion later on, that's some indication to me that there's some interest in doing it. And so we do try between whenever that night is till the final public hearing to see, is there a way to make it happen?
Okay.
And that we can suggest. And sometimes the answer is, we don't have any suggestions, and you just figure it out yourself, or you don't do it. Or sometimes we do figure it out. So, yeah, we would look at that if you end up putting it on the table. But I will tell you that it would be highly unlikely that I would come back to you and recommend a one-time funding source for a continuing annual expenditure. It wouldn't be 1,000% out of the question, but it'd be like 999% out of the question, because then I know I'd just be sitting here next year trying to figure out how to fund it already on the books, starting $90,000 in the hole in the budget. And So that,
Right, but perhaps some of the revenues would get back to a more normal and an increased state too, to perhaps offset that as well, as you look at that. Just a thought. So, but thank you, and I appreciate the conversation and the learning about the process here. So, thank you.
So are you still making the proposal?
Yes, I am, for the
Okay.
full-time,
All right,
yes.
for a full-time position?
Yes.
Okay.
Yes.
Well, then at this point, since we've all had a chance to weigh in, I would ask just for a straw poll here around the table to see who would be for that or against it at this point. So if you're for the idea of holding this for separate discussion at a later date, go ahead and raise your hand now. We have three. I'll weigh in and say, yes, we can hold it then for later. So we have, I'll vote for it as well. So we will ask you, Mike, to please hold that one for separate discussion later on. We can talk about that as we go through this process, keeping in mind this entire discussion here. So I do appreciate the fact that we've had this discussion at the table tonight to be able to think about this as the process goes on. Okay. Mary Rose, thank you very much to you and your entire department. I feel like I've said thank you to you more than I've said thank you to anybody in the last 2 years, but I never stopped meeting it, and we never stopped meeting it. So thank you very much for everything.
Thank you all.
Okay. So we will move on then. Our second presentation tonight is the library, Carnegie Style Library. So I'll invite Nick Rossman to come up. We'll go ahead and let you get set up here, and then we'll get started.
You said it. I'll work on this. Just so you're comfortable. Save. I don't know, I guess save. I guess we're gonna change. All right. I think I hit like 3 buttons there. All right, so you got the mouse, or you can use the arrow. Either one.
Thank you.
Yeah.
Are we ready to roll? All right, yeah, sure enough. All right. All right, then we have, next up is the Carnegie Style Library for tonight. We have 2 improvement packages requested and 1 recommended for the evening. So, Mr. Rossman, I'll let you get started.
All right, thank you very much. And you guys can all hear me? Yeah? Okay.
Yeah.
Well, my name is Nick Rossman. I'm the director of the Carnegie Stout Public Library. I'm very pleased to be here tonight presenting to share how the Carnegie Stout Public Library enriches our community. So, let's start here with the mission statement. So we aim to improve the quality of life of our community by providing resources of enjoyment, enlightenment, knowledge, and we especially want to enhance the literacy of the youth of our community. We have 35.15 full-time equivalencies across various departments within the library, adult services, information technology, our technical services staff, building maintenance, our circulation staff, and then our youth services. Some of our efforts to provide a equitable community of choice. In 2021, the library participated in what is called a diversity audit of our bibliographic records. We sent those records off to a vendor that cross-checked them with their bibliographic data, and they sent back that we had a little more than about a 12% of our collection contained inclusive elements across 11 different categories. We believe that this number can improve, and so we're making efforts toward that, but we've also seen a concerted effort from the large vendors that we purchase materials from that are providing specified lists that help our staff that select materials and purchase materials to do that across a large spectrum of inclusive and diverse titles. So we're also currently working with the Dubuque County Juvenile Court System to provide the Changing Lives Through Literature program. This is a 5-week literature-based program that provides an opportunity for low-risk adolescents to avoid lengthier probations for offenses. There was a little break from the program during COVID, but we're excited that we've got a group of that are currently meeting, started last week, so we're kind of back up and running, and that replenishes as they identify adolescents that qualify for the program. And we'll also be in 2023, in February, we'll need to submit our application of accreditation through the State Library of Iowa. And part of that process is reviewing all of our policies. So as we go through and review those policies and make some changes, we'll be doing so with an equity lens. So Just kind of going through some of our fiscal year highlights for fiscal year '21. We saw nearly 130,000 visitors through the door. We are up over 40,000 card holders, and we saw collection use of over 650,000 items. And I'll talk a little bit more about what I mean about collection use here in a bit. We also opened the Story Walk at the Bee Branch Creek Greenway, which we're really excited about. We checked out over 100,000 digital materials. We added more than 18,000 items to our collection, and we implemented a new catalog, which I believe eases the searching of materials for our patrons. I'll kind of show you a real small shot of that, but what we're looking at here is just one title of a book. You can see the picture there. This title is The Last Thing He Told Me, which is a book by Laura Dave. What you're looking at is all the little boxes there. Some of the print's really small, but there's a lot of information on here. So what we have across these various formats, so we own this title as just a regular printed book. We have it as an audiobook on CD. We have it as an audiobook that's available digitally, as a digital ebook, and then also as a large print. So that's 5 different formats that we have this book. In our previous catalog, what this would actually show up as 5 separate entries of the last thing he told me, the last thing he told me, the last thing he told me. So if you're a huge Laura Dave fan and you just want the newest copy of her book and you don't care what format it's in, you can very easily see which one's available. All the availability there is kind of color-coded, and you can see at the time I grabbed this screenshot, it was quite popular, so most of our copies were checked out unless you had a CD in your car or still have a CD player at home. You could borrow the audiobook on CD. And so everything is available to place on hold. There's in the very small right-hand corner there, you can see just a little synopsis of what the material is about. And yeah, there's also up high, you can see there's series information. So this specific book is part of the Reese Witherspoon Book Club. If that excites you, you can click on anything that's blue is also clickable. So that would then take you to any other of Reese's Book Club books that are available in our catalog. And just kind of round out the highlights for the fiscal year, we did have over 200 programs for our youth, over 50 programs for adults, and 5,500 people that attended all those programs. These programs were some in person, but a lot of virtual as well. And we also, as I mentioned before, performed the diversity audit of our materials collection. So when I talked about collection use, this is kind of what I'm talking about. We have all of our physical materials that are in the building, the digital materials, but we also provide databases to the community. And so what you'll see on this graph here is 33% of our collection use was actually retrieval of electronic information, and that's those databases. So it's a fairly significant part of what we do. Some of those resources, the databases, we actually maintain the data. Some of them we just pay a fee that gives all the community access to. After that 33%, then 31% is the print materials, the books, magazines, comic books, that kind of stuff. And then 17% both for digital items and then movies and TV shows. And then that other is kind of the last little bit of 3% is our audio stuff, which is the stuff on CD is starting to kind of slowly die down, that technology. And then the other items, the cake pans, video games, that does include our Wi-Fi hotspots, which is right now is about 48 items. We did add some new ones in fiscal year '21. They're very popular. We do have some patrons that use them as a primary source of internet access, but we also have some people who are using them to just pacify their teenagers while they're taking a long trip on spring break. So they're popular across all kinds of people. We also saw if there's kind of pretty much an even split as far as books are concerned for our adult books versus the youth books. And if you're talking about just books alone, over 200,000 were checked out in fiscal year '21. This is just our budget from fiscal year '21. We came in a little under budget. We did see some freezes with some staff positions and then some of the operations cost. And about 70% of our expenditures is staff. That's actually, I think, of the top 10 largest cities in Iowa, there's only 2 other cities that are a little bit lower as far as their percentage of staff expenditures. So I feel like we're fairly efficient when it comes to that, and we get a good return on the investment, especially considering we're about third when you consider the number of items we circulate compared to the number of full-time equivalency staff we have, so of the same 10 large city libraries. And speaking of kind of a return, this slide here just kind of demonstrates for our borrowers, when you look at some of the various material types that we have, we found an estimated average retail price for some of those materials, and then we took our fiscal year circulation numbers and figured this is what our borrowers are saving every year instead of purchasing these materials outright. So it's almost $6.5 million. And this doesn't even take into account the electronic information that people are accessing, some of the fantastic programming that we're doing, and the literacy work as well. So this is money that then can be saved and put into a future college tuition or possibly reinvested into the local economy. And some of the big things that we have coming up is the partnership that we're excited about with the Dubuque Community School District. It's a school, what will happen is all middle school and high school students are going to be able to use their school ID as a library card. It'll happen automatically. We are very close to having this implemented, just kind of doing some tests and getting some websites built and that kind of stuff. So that's on the horizon. We also have launched a self-guided and virtual library art tour. The library owns about almost 100 pieces of art that are on display throughout the building, and you can come in and download an app and actually walk through the building, and there's a little blurb, kind of a audio piece that'll tell you about the piece, or you can just do it from the comfort of your own home if you don't want to come down. But you should come down. It's a nice building. We also have a couple of new collections that we're excited about that will be prepared. The memory care kits are, they're going to be like these large tubs, not too large, but tubs that are designed to help provide tools to combat Alzheimer's, or they could be used to trigger special memories of life experiences and encourage interaction between patients with dementia and their caregivers. And we're also putting together something called adventure kits, and these are designed to promote outdoor activities, so the focus would be trail maps, bird watching, nature-inspired crafting, stuff like that. And then I kind of talked about our Wi-Fi hotspots before, but we did add some new ones this year. So the vendor we work for to purchase those, they're also in high demand really nationally, globally. So we're kind of limited how many we can buy every year. So it's always exciting when we can re-up and get some more, as we feel like the need is necessary, of course. So, our COVID service impact. So some things that we, as every organization has, the libraries had to make some fairly significant adjustments to our traditional service methods. We're now offering curbside pickup of all library materials at the Locust Street kind of side door. We have a plaque that goes out, and people can call as they pull up, and we'll check their items out and bring them right out to them. We see over 100 people that are doing that every month, so it's a fairly popular service. We've transitioned all of our story times to be virtual, a lot of other virtual programming, author discussions, book clubs, stuff like that. Now that COVID's hopefully rounding out, we're hopefully going to start doing some more back inside the building, which we're really excited about. But we've also created thousands of take and make craft kits that staff have made, or some of them were made in our makerspace. And we expanded our programming outside of the library walls, offering programs and story times in places like Washington Park, the Dubuque Farmers Market, Bunker Hill Golf Course, and the Dubuque Arboretum and Botanical Gardens. A lot of this we were able to accomplish due to a grant called Programs to People that was provided by the Dubuque Racing Association and the Carnegie Stout Public Library Foundation. Along with all of our usual library services and programming that we do every year, we do have a couple big projects that are going to be happening. One is going to be the strategic plan. That was been on the docket for a while. Everything got delayed with COVID, but we are planning on having that happen this spring with some focus groups. Hopefully we're going to be connecting with library users, library advocates, library staff, some stakeholders, various partners, and hopefully we'll be able to connect with some people who maybe don't or haven't used the library in some time. And then we also are going to be implementing another story walk. This time it's a partnership with the Dubuque Arboretum Botanical Gardens. And this story walk was provided by the American Rescue Plan Act, a grant that we applied through the State Library of Iowa. Our property tax support this year is $58.16 to the average homeowner. And just real quick, I want to talk about our gift trust. So we have the Lacey Trust, and that's a permanent fund there that the earnings are used to purchase materials of lasting value in the areas of travel, science, fine arts, and biographies. The Lowell Art Trust is used for framing, hanging, care, and maintenance of library-owned artworks. The James Muchler Trust was a donation designated to enhance library services. The Walton Trust is a revenue fund that was designated by the trustees to be used for the purpose of conservation and preservation of library materials of historic value. And then the General Library Trust is a depository for some of the bequests that are smaller in financial scope, grants and other donations and things like that. And those are typically used according to the donor's wishes, but then just depends on the grant projects and that kind of stuff too. So, and just to kind of show what kind of projects go through that general gift trust. This kind of just shows what that beginning balance is, some of the projects that we're committed to this year, so you can see the strategic plan on there. We get some money from the state of Iowa every year. We're planning on purchasing more digital materials, which have been in high demand, some art appraisal and conservation there, and then the Changing Lives Through Literature, which was a grant provided by Better World Books, and just some other various programs that we're doing. And then for our improvement packages, so as you mentioned, we have 2 packages that were requested. The full-time Makerspace lead library assistant was one that was recommended. And what this is doing is actually combining 2 20-hour part-time Makerspace library assistants and turning that into a full-time lead library assistant position. So the budgeting impact would be a little bit raise of wage, but then also the addition of the benefits is incorporated into that cost. What we're wanting to do with this is, what we've realized is in the Makerspace, there's a lot of fairly highly technical equipment that for a 20-hour staff person, it just takes it's a steep curve to learn how all of it works and operate it and be able to effectively make neat things. So I think, our idea is we get a full-time person in there that can really keep themselves up to date on all the equipment, and then they're also available, and then we also want to, have that staff person be able to provide more robust programming, do some outreach, get outside of the building as well. So. And the second request was not recommended, but the library board and I felt it was just important for us to present on the importance that we felt of adding this position into the general fund. We just, to get rid of a temporary contract, the staff member who's been doing this is kind of year to year, and it would be beneficial for her to feel as part of the team, but also just promotion and marketing is such an important aspect of what any library does, but specifically a modern library and a library of our size. There's so much going on in the city of Dubuque, and we want to make sure that we can get our services, our messaging, and what programming we're doing out to the community, so more people know that what we do. And then just to kind of round things out, we'll go through our performance measures. We had over 100 visits to area childcares with AmeriCorps staff. We were not able to do any leadership enrichment after school programs this year because of COVID. We did check out nearly 150,000 items to our children. For our adult services, we had over 200,000 electronic information resources access. That's the database information. Over 100,000 digital materials. Just about 1,000 attendees to our adult programs that we held for 57 of those. And then just our circulation numbers. So we do have over 180,000 items that are available for checkout at the Carnegie Stout Public Library. The number of registered borrowers as a percentage of our population is sitting about 69%. We did almost 250 deliveries to our homebound patrons that we pretty much honestly select the materials for them and then take them to their home, and we'll pick them up when they're done. So, and then the TH Newspaper Archives, which is a very popular database that we have, is we had over 150,000 hits on that. So, and that is it from me. So, open it up to any questions.
Okay.
Thank you very much.
Thank you very much for the presentation. We'll start with public comment, so we can open up that.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, do we have any public input here in chambers for this presentation? How about virtually?
No virtual input.
Okay, bring it back to the table here for discussion then. Yeah, Ms. Roussel.
Well, thank you for your presentation. I think our library is just truly a treasure, and any resident that hasn't been down to see it needs to do so. So thanks for all that you do to keep our library relevant in this digital age. It was great to see how many people are coming down to use the library. I did have one question. In your statistics about materials that are available, and I know we have a large number, but it seems to have gone down quite a bit from a couple years ago when it was at 255,000. Now it's down to 185,000. I just wondered what kind of changes had happened there.
You know, I'm going to be 100% honest with you. I am not entirely sure. You know, we do have to do weeding. We have to regularly weed for materials that are outdated or just not in good shape. No one wants to come down and check out a library book that's about to fall apart. So, you know, I think with some of the crossover of moving to a new system, the catalog, and a new director, with some of the reporting, it's hard to say. I just know that our staff that are generating those lists, that we have 180,000 items that are in our catalog, and I honestly do not know. I'm assuming some of it is just, during COVID, we did do some large weeding projects, I'm told. So I don't know if some of it sometimes we have limited space in that building.
Sure.
So just trying to keep our shelves not completely packed full. So I think that's part of it, but some of it I'm not sure.
Well, that makes sense. We still have an awesome offering here at our library, so thank you.
Yeah, it's a good collection.
Mr. Mayor.
Mr. Resnick.
Yes, thanks for your presentation. I was taken with your, the last thing he told me slide, when you have all that information on there, which is really great, about that book. And I noticed you say down at the bottom, it says add a review. And Ms. Roussel said keep it relevant, and you are. And I'm wondering if any other libraries do some kind of feedback, like if you go to Amazon, it says recommend, or this is popular, or there's, gaining momentum. And then you can click and see what the user reviews are, because that kind of feedback, I remember I enjoy reading books, but I didn't like to get to the middle of the book and wish I hadn't started this one. There's too many other great books I could have read that I could have used some more feedback to know what's between the covers. So what are you doing for that?
Well, we actually we have a resource, a database that we provide access to. Is called Novelist, and you can type in any book you've read that you've really liked, and it will give you kind of similar recommendations. Or you can call down to our recommendations desk, and we have some librarians there that will very easily be able to identify some items that are very similar to something that you've read, or if there's a certain genre you like. I mentioned that we do that for all of our homebound. Is most of the people that are enrolled in that program, I really like mysteries or this type of story. And, some of those authors, there's only so many read-alike authors. So after they've read through all of those read-alikes, then you have to start getting a little bit creative. And I think our staff do a really great job of that. So, we have a database that can do it, but we also have really qualified staff that can do it as well. So.
All right, thanks. It's good to hear. I didn't know if you could put it right in front of their faces, like on this.
Yes, actually, you have the ability to actually type in a review as well. It's fairly new. I mean, we've had it for a few months, but I don't think a lot of people have started doing it yet, but our system does have that capability.
I don't see a button where it says reviews or read reviews. I know I could add one. Do I get to read everybody else's then?
I believe it's just, if you type in a review, then anybody else could see it if you had typed one in for that specific title.
Right, and they click add a review to
I think
read
it would,
mine?
if there were reviews, it would say read the reviews, I believe.
I see. All right, well, thank you very much.
Ms. Farber.
So thank you for your presentation, and I'm very pleased to see that there's actually an app so you can walk through the building and really appreciate the enormous and very rich collection that we have of art. It is absolutely amazing, and I would strongly recommend if people haven't taken a tour that they should. It is just fabulous. And also kudos for the virtual tour so that people who can't can do that. I do have a question about overtime. You have it listed as unchanged at 27,000, almost 300. Could you just give us a little history on that? Is it because people are working extra hours or lack of staff?
Yeah.
Budget actually was 69. The budget available for staff to work overtime.
Yeah. So could you ask me the question again? I'm sorry.
So I'm just curious, is that just normal overtime for all the people that are working? Because you have a lot of people
we have,
there.
I mean, quite a number of our staff are 20 or 25 hours a week.
Okay, so got
So
it.
that's what they're budgeted for. And sometimes just if there's illnesses or somebody's on vacation, gone for a
Gotcha.
while, then some staff may work a little bit more
So,
than the
okay,
25
I
or something
understand.
in a given
Okay.
week. But yeah.
All right, no worries. Thank you very much.
Yeah.
Thank you, Ms. Mayor.
Thank you. I have a couple of questions for you, actually. The first is, we had a conversation here last night about parking and employee parking and how that works. There's a proposal on the table for several of our, for City Hall, City Annex, and the MFC to have the city pay for parking. And it came up last night that I didn't see the library or this building, the federal building, on there. And I was just curious if that's something that has come across your radar and is something that your employees are asking for, or if that's something that you'd be considering in future years.
No, that would be very beneficial. I mean, and not just for employees, but for some of our visitors to have a little. And I know downtown specifically, it's a challenge because how do you there's so many residential areas right in our neighborhood. So how do you keep the residents out versus library patrons versus staff? But no, absolutely, it's definitely an issue. I think often you hear people that are in the building saying, "Oh no, we've got to go because our meter's about to run out," and it's always sad. Then you just watch a 3-year-old crying as they are being exited out of the youth department because of a meter. So it certainly is something that is a concern of ours. We expect that will come up while we're doing our strategic planning and focus group as part of access to the building is just the parking situation in that area. Absolutely.
Yeah. Well, and specifically for employees, we talk about it as an equity issue in the discussion last night, for employees that might not be making as much as other employees and the ability to be able to park. So I think it would be an important thing to bring up in strategic planning. One more question then is about, the library is often a place where, it's for everyone. Everyone can go there. It's for every single resident who lives here. Even somebody who might be experiencing homelessness, somebody who might be experiencing food insecurity. I know the Urban Bicycle Food Mission is one example of a group that gathers right outside the library oftentimes on the nights that they're doing their meals. Do you partner with any organizations for social work services or any sort of social services that could be provided there that you might not need to staff yourself, but we have partners in the community that can provide those things?
It's actually becoming a very popular movement in libraries. In fact, Davenport has just hired their first full-time social worker on staff. So it is something we have talked with Clark about, possibly some kind of an internship program or practicum for graduate level students. We're still kind of feeling that out, but it is a very, very significant concern for librarians, for public libraries. Yeah, we do see a significant amount of people that are suffering with brain health issues that are in the building. So it does happen. We deal with it fairly regularly. So, yeah, absolutely.
Well, it's great to hear you're exploring those options. It is a real point of contact for people who might be struggling with things like that. So thank you. All right. Well, then I think that's everything we have for you, Nick. So thank you very much for the presentation and all the work that you do. We really appreciate it.
Thank you very much.
Thank you. Okay, next up we have the airport. So as Todd comes up to get ready here, we'll give him a few minutes. Yeah, I'm
to
staying
adjust
earlier
this.
tonight than last night.
All right, so that maybe need to adjust it. Or you got mouse, or you can do right here.
Yeah. An incredible story. Oh, really? He's had like 30.
This year. So Todd, I'll let you get started.
Great, thanks, and good evening, Mayor and City Council. Todd Dalsing, Dubuque Regional Airport. I'm going to leave our mission statement up while I introduce our airport commissioners. From left to right on your screen, we've got Mike Phillips, who's our current chair, Marianne Kurtz-Weber, vice chair, Sue Clemenson, RJ Blocker, and now that we're all back together, and I believe Doug Brotherton is here, and I wanted to recognize him. This is his 28th year volunteering as an airport commissioner. So I'd like to thank Doug and all the commissioners for their service. Last year I said 27, but we were virtual, so this was a little more special. Airport commission goals is to retain and increase air service, expand corporate and general aviation, increase visibility and awareness of airport services, maintain our existing facilities, expand facilities to attract new business and increase service levels, and of course, increase and diversify our revenue streams. Our Dubuque Airport organizational chart, we have 4 departments that provide service to our customers and help keep the airport operating in a safe and secure manner 24 hours a day, 7 days a week, 365 days a year. Those departments are airport administration. We've got Dan Claus, who's the assistant director, and he also oversees our operations and maintenance department. Cheryl Sheldon is our airport accountant, who's also joining us tonight. Karen Spizak is our marketing coordinator. And then in our airport operations department, we have 3 operations specialists. They rotate a 24-hour shift. They are Jesse Kramer, Chad Welsh, and Roger Wickman. In our airport maintenance department, we have 3 maintenance workers, Jason DeMeo, Art Martin, and Jeff Petty. 1 mechanic, Bob Moyer, and Connie Simon. She's one of our custodial workers. And then in our Dubuque Jet Center, we have Adam Langbecker. He's the FBO supervisor. Timothy Furlong is the assistant FBO supervisor. We have 2 CSRs, or customer service representatives, Tina Herrig and Tina Malone, and about 6 to 8 part-time line service workers, and usually about half to maybe a little bit more of them are usually University of Dubuque flight students. So we get quite a bit of turnover in that area. So the highlighted proposed, it's highlighted because it is a recommended improvement level package for a second assistant FBO supervisor at the Dubuque Jet Center, because the Jet Center operates 16 hours a day, 7 days a week. And with the increased aircraft operations that you'll see soon, as well as fuel sales and all the events we have, it's important to have a full-time consistency and leadership during those business hours. So creating an equity and community of choice, Dubuque Airport follows the Airport Equity Plan. We incorporate FAA disadvantaged business entrepreneurs or enterprises and targeted small business plans into our airport projects. We utilize ground handling equipment, upgrading our buildings and airfield to LED lighting. Our terminal building is Silver LEED certified, and we're proposing solar arrays that I'll touch on soon as well. We have multiple federal, state, and local legislative and business and organization partnerships. We continue to have a low full-time turnover rate and encourage all of our employees to use a citywide employee assistant program. I'm going to talk about below fiscal year 2022 highlights. First up, we've got the Airfield Pavement Maintenance Program. This is 100% federally funded under the FAA Airport Improvement Program at a cost of just over $78,000. This is the FAA requires a pavement maintenance program update, including an engineer survey be performed at least once every 3 years. Overall, the project inspects 3.4 million square feet of pavement on the airfield, which obviously includes our runways, aprons, taxiways, but it does not include our landside pavings like our roads and sidewalks and things like that. The final report assesses the pavement conditions. Staff uses this program to plan, budget, and remain eligible for our FAA AIP funds. Master plan update. This is another FAA AIP project, and it was just over $595,000. This was a 90-10 split, so 90% of that was paid by the FAA and 10% local, so our match was $59,502 for the entire project. So in addition to staff working with our consultant, Kaufman and Associates, technical advisory committee was formed, made up of over 30 airport representatives and community leadership, including some of you on the, Councilman Jones was on it, former Mayor Buell was on it, City Manager Van Milligan, just for a few, and Greater Dubuque Development was invited there in the room as well. And then we also had 3 public work sessions that were held. Public was welcome to review the information boards and draft copies of the master plan and provide feedback on our website or in person. The City Council, we held a work session in September. Airport Commission approved the plan in October, and City Council final approval was in November of 2021. The master plan is a 541-page document to assist with guiding the airport for the next 20 years. The chapters include our current inventory that we have at the airport, forecast, facility requirements, alternatives, recommended development and capital improvement plan, which is the example you can see on the left of your screen there. And then there's also appendixes that discuss solid waste and recycling plans, energy assessments, and economic input, which is the example shown on your right. And at the bottom of that example, you can see the direct and secondary economic benefits, which equal 711 jobs, 28.1 million in payroll, and 78.5 million in output. And there is a complete copy of the plan available on our website at flydbq.com if anybody's interested in checking that out. Another FAA airport improvement program was rehab our runway lighting and electrical vault that we finished up. This was 100% eligible under the CARES Act, and that project totaled just over $2 million. If it wasn't for the CARES Act, this would have been a 90-10 split again, so that equates to a local savings of just over $203,000 to the airport and the city. Project replaced all cabling and incandescent lights with LED on both runways. Constructed a new electrical vault, which is pictured in the bottom bottom right of your screen. The original vault that we replaced was constructed in the 1950s, so it was well overdue. And we also upgraded lighting control equipment in our air traffic control tower, replaced about another 1950s rotating beacon, and installed new approach lights on runway 18. We added an additional avgas fuel tank. So we just kind of touched on the FAA stuff. Now I'm going to switch gears over to the Iowa Department of Transportation. And this is a commercial service vertical infrastructure project. This project total was $272,000, just over $272,000. This one was an 80-20 split, so locally, our local cost was $54,050. and we added a 20,000 gallon low lead tank to meet our increase in fuel demand. We also relocated our emergency generator. Again, another DOT commercial service vertical infrastructure project. This one was 100% state funded, eligible, and that was just under $190,000. So when we worked on the FAA lighting project, we still had a very well-running emergency generator. So we relocated that. And we're using it to now as backup power for our Dubuque Jet Center and our joint use facility. And our joint use facility includes our aircraft rescue firefighting equipment as well, and as well as the administrative offices in the Dubuque Jet Center second floor. Our FY23 requested operating budget summary. Federal airport relief funds are included in our FY23 requested operations budget summary. The airport received 3 rounds of federal relief and can be used for debt service and operational costs. So between the CARES Act, the CRISA, and the ARPA, Dubuque received just over $3.3 million. We're also looking forward to the infrastructure bill, and Dubuque is programmed to receive just over $1 million. Those funds will go towards similar FAA projects that I had just mentioned for the local match. And we're also, many of you are aware from the media, I'm sure, that we also requested a portion of there's $200 million set aside in the infrastructure bill with funds dedicated to contract air traffic control towers, and Dubuque happens to be a contract air traffic control tower. So we've got requests in for some funding for that, and we've got full federal legislator support. Our property tax support, reducing airport tax askings so from those grants that we just talked about, the $3.3 million, in FY21 and 22, the operating budget funds went towards debt service and equipment. FY23 operating budget we're requesting to be used for debt service and equipment, and FY23 capital requesting to be used towards our FAA AIP project, which we'll be talking about shortly, to construct Taxiway Alpha 10% local match, as well as some hangar repairs. Our FY23 net property tax support and annual average homeowners property tax costs. Our COVID timeline, COVID commercial air service impact this fiscal year, so starting in July. The airline CEOs expressed optimism that the travel is coming back and quicker than anticipated. Then in November, kind of before the holidays, the numbers dipped, but the airline CEOs were hopeful that those would come back up. In December, the passenger numbers flatlined, and the airline CEOs testified to the Senate, and mainly that the commercial pilot demand was severe and will continue to impact operations nationwide. In late December, matter of fact, it was between Christmas and New Year's, I remember it well, we had a meeting, the airport and the chamber had a meeting with our air service consultant to review the data and what Dubuque needs to do to remain competitive and retain service. In January, we met with our Air Service Task Force, chamber-led Air Service Task Force, and we also have been scheduling and attending individual business meetings to educate and inform of our current status. And starting here in another week or two, we're going to be kicking off a Fly DBQ First marketing / educational program. All right, our COVID impact. So this is a nationwide passengers that have gone through TSA screening checkpoint on the first day of the month only. So this is just one day of the month, and it's only for comparison. The blue line represents 2019 passengers or pre-COVID. So that's the blue line at the top. The red line represents 2020, which, it started off the year pretty good. And then, of course, that's when COVID hit. And for aviation, it meant a 96% decrease in passenger demand over March of 2019. The green line represents 2021, which continued to show an increase, as you can see, it had peaked up. And I just mentioned in July, the CEOs were hopeful that things were going to get back to normal. And then things dipped down again. And the purple line represents 2022, which today nationwide, we're still about 300,000 passengers down, and that's per day from pre-COVID levels. So as well as you can see from the graph, but 2021 was not a good year for carriers. American Airlines posted a loss of $5.4 billion. And because of the assistance of the federal payroll support program, their actual net loss was $2 billion. I mentioned the airlines testified before the Senate. Doug Parker, who's with American, which is of course our current carrier, said that we serve over 230 communities. However, at this point in time, it is an issue that we won't be able to continue servicing all the communities without the hiring of additional pilots. And Scott Kirby, who's with United Airlines, and who we've actually been talking to pre-COVID about adding service westbound, when asked about rural communities, there has been a looming pilot shortage in the United States, particularly regional carriers. We don't have enough airplanes to fly some of these routes. Almost 100 airplanes are effectively grounded because not enough pilots. We're seeking to train 5,000 pilots, and that's just United, by the way. That's not all air carriers, by the end of the decade. And the country's going to need thousands of pilots. So it reemphasizes the need of the pilot shortage. So national impact, the extreme pilot shortage, scope clause, and what a scope clause is, it's a union agreement with the airline that they can't have more regional flights than mainline flights. The increased fuel prices, I'm sure everybody here has seen the cost of the barrel continue to go up. Labor and fuel are the two highest expenses for air carriers. Reduction of corporate travel. A lot of the numbers that I've shown you have all been leisure travelers going to beaches and mountains and things like that. And the airlines really basically a three-legged stool. So you've got international travel, you've got business travel, and you got leisure traveler. The leisure travel is extremely high right now, but they really make their revenue off the international travel and the business travel, which is at an all-time low. We're competing with 235 regional airports in the United States, just like Dubuque. And since April 22, airlines have stopped flying to over 40 small communities like Dubuque. So we are, as I mentioned, kicking off a marketing initiative. We're partnering with the Chamber of Commerce, launching the Fly Dubuque First initiative, a call to action in education, which includes a new website launch page and community-focused digital marketing educational campaign. We're featuring local community leaders. Chamber and airport have been meeting one-on-one with local businesses, as I've mentioned. And then also later this month in March, Chamber and Airport, Molly and I will be attending the Meet and Hunt Air Service Conference, and we'll be listening to the current status of different carriers. And we also have scheduled one-on-one meetings with the airlines. So currently, we're scheduled to meet with American, who obviously we talk to pretty much on a daily basis now at a local, regional, and national level. And we still keep in touch, and we're going to be meeting with United and SkyWest. We continue conversations with them. Really, we continue with them all, but we're scheduled to meet with American, United, SkyWest, Sun Country, Allegiant, and Breeze Airlines. Air carrier local support. So in addition to marketing, the City Council, Airport Commission, and staff continues to provide quality service at a low cost to our carrier American. And some of those examples include we have and continue to offer low rates and charges. To put that into perspective, Dubuque rent equals about $3.91 per enplaned passenger. Compared to Waterloo is at over $8, Cedar Rapids is over $6, Des Moines is over $9. We continue to offer low landing fees at 82 cents per 1,000 pounds. Compared to Sioux City, that's $1.19, Waterloo's $1.69, Cedar Rapids $2.19, and Des Moines is $3.07. We continued use of airport-owned and maintained ground handling equipment, which is pictured below right. All that equipment you see on the apron there, we offer to our air carriers. 24/7 airfield operations, including snow removal ops, coordinated to flight schedules. Even when there's a delay, if it was supposed to come in at 8 p.m. and it's delayed till 10, 11, 12, 1, whatever it is, our guys stay on it and make sure, guys and gals, stay on it and make sure the airfield is in a safe condition for them to come in and land. Free airline customer parking, as you all know, we have free parking at Dubuque Regional Airport. We're one of the only airports, we're the only airport in Iowa and probably in the tri-states that offers free parking still. And of course, we offer legislative support when called upon, which the carriers appreciate very much. But in the end, Dubuque Airport is the landlord and American is the tenant. And the tenant controls the flight schedules, times, and costs, but the airport users determine if we retain and expand service. So our current commercial air service, or what do we have today? We have American Airlines with daily flights to Chicago. We offer Sun Country public charters to Laughlin, Biloxi, and added this fiscal year to Atlantic City. That's been very popular. We host private charters, and some of those examples are the Major League Baseball teams that flew in and the Army Air National Guard. What are our goals? For American, obviously, it's to retain existing service and add flights as demand returns, upgrade aircraft from our current 50-seat regional jets to 70-plus seat regional jets. Of course, attract new service as travel resumes, attract new service, and potentially using our small community air service development grant, which we still have, and I can't remember when it expires. I want to say it's 2 to 3 years from now, but we can always request, especially due to COVID, request an extension on that. And then we also are always looking to add new charter events and destinations on Sun Country. Captain Robert L. Martin terminal naming update for you. Top right picture is a proposed exterior monument sign that will be erected at the Three Flag display off our entrance road. The bottom left image is an example of an interior bronze relief that we'll be installing in the terminal on the wall near the observation windows in the restaurant. Some other items include adding exterior pedestrian signage on the side of the terminal building, educational materials playing on our terminal monitors and display items. Tentative naming ceremony is scheduled for mid-July, but I'm not going to give a date right now. Stay tuned. We'll more information to come. We work with our tenants to promote high-quality airport services. Blue Skies over Dubuque. They provide aircraft maintenance to local and transient general aviation, our commercial aircraft customers. University of Dubuque, just a fantastic program, continues to grow. Over 300 students, instructors, and staff operating out of the Babka Flight Center and 3 corporate hangars. And they lease anywhere from 25 to 30 aircraft, including fixed wing and helicopters. EAA is the Experimental Aircraft Association, local chapter 327. They lease hangar space as part of a partnership with the airport to help build our general aviation awareness and education. And new this year, starting in fall of 2022, to even maybe smallly help close that gap of aviation workforce shortage, NICC partnering with UD, EAA, and the airport are going to start an accredited avionics maintenance program. So we're all very excited about that. And all above organizations also volunteer during the wide variety of airport events that we hold throughout the year. As COVID restrictions lift, we'll resume our partnerships and continue providing community outreach at the airport. Some of the examples showing up from past outreach on the left there, or left and right. FY23 recommended improvement package. I touched on this already in our org chart for a full-time assisted FBO supervisor. Our FY23 capital improvement projects, I'll review a couple of the higher dollar ones for you now. Rehabilitate Taxiway Alpha construction project. This is another FAA airport improvement project. This phase is estimated to be at around $3.1 million. It's 90, again, a 90-10 split, so 90% federally funded at just over $2.7 million and locally at $310,000. This FY23 construction is phase 1 of 4, which is shown as green on the top of the slide there. The total project is going to cost over $12 million, replacing failing or failed existing Taxiway Alpha pavement, and that is confirmed in our Dubuque pavement maintenance program that I mentioned earlier that we had just completed, and that's also the reason it's eligible for AIP funds. Another proposed federal project that we don't have an AIP entitlement for this yet, but we're proposing to construct a solar array system at just over $1.1 million. So we're working with the FAA. The FAA does have some monies and some funds, although they don't have any obligated, but we're always on the lookout for any other federal organizations, especially with the infrastructure bill and some others floating around out there where there could be some opportunity for energy projects. We're looking at 2 locations. The top picture shows an array next to the terminal entrance road to provide power to the terminal and our airfield lighting. And the bottom picture shows an array behind our snow removal equipment storage facility to provide power to Dubuque Jet Center and our joint use facility. So our 2022 airport events that have occurred since our last budget presentation back in April of 2021, the Iowa Army National Guard Homecoming. This was a special event. The Guard returned, they arrived at Dubuque. We kind of huddled them in the sterile hold area for a little bit to gather themselves. And then we walked them out the exit lane and through a homecoming crowd in the terminal, and then a final formation before being reunited with their family and friends. And again, last April, we had a 5K Run the Runways to bring awareness for human trafficking. That we're going to be holding this again. I believe the date is April 9th. You can check our website for details and registration. It's a great event. We also partner with the University of Dubuque on that event. We're going to also have our July 3rd air show and aircraft viewing. We had it in 2021. Again, that'll be back in 2022, similar format. The air show itself will be on July 3rd, aircraft viewing on July 2nd, and then we do multiple Golden Knights, Army Golden Knights jumps around our tri-state area, multiple. So we're on the run those 4 days. North American Trainers Association, they're going to come back. I can't remember what year this is. I'm going to say it's like the 16th or 17th year that they've been coming to Dubuque because they like it so much. So they're here for a full week. They practice their formation flight before they go to Oshkosh. And you can see on the top are they all, a bunch of them lined up on the taxiway getting ready to take off. And then the top picture is a formation simulation as they passed over the airport. A little baseball game we had this summer that some of you may remember. It was a pretty cool event for the airport as well, the Major League Baseball Field of Dreams. I can't say enough about our team at the airport and even working with MLB and our airfield tenants and carriers and so many others. There was just months of planning that went on because it was a first for us. It was something new. And so we wanted to make sure we shined, and I think we did. Dubuque staff turned both teams aircraft charters, the Yankees 757 and the White Sox 737 on our terminal apron. And that was during American Airlines scheduled operations. That's pictured above left. We had multiple corporate aircraft reservations, some dropping off and going and then coming back and picking up, some staying during the event. We had approximately 65 large corporate aircraft parked on a closed runway, and that was pictured middle right. We worked with MLB and the military to stage the aircraft flyover during the game's national anthem. That's top right picture of the A-10s taxiing back after they had done the flyby. We extended our air traffic control tower hours of operation to 1 a.m. Normally it's 6 a.m. to 10 p.m., but we recognize that a lot of these aircraft or all these passengers were going to be coming back at that 9, 10, 11 o'clock time frame, and it was just going to be a mad dash to get out of there. So for safety reasons, we lobbied the FAA and we're able to extend those tower operations. All city airport employees and several volunteers worked the day of the game to make it a safe and efficient operation. And we received multiple compliments from crew and passengers who routinely flew into events like the Kentucky Derby and the Masters golf outing. So that was encouraging. The staff did an absolutely fantastic job. Partnering with the University of Dubuque for the Rise Above exhibit, and that featured an educational trailer with movie and a P-51 Mustang on display, and they are also giving rides, similar to what the Tuskegee Airmen flew. We also helped coordinate the P-51 flyby during a University of Dubuque football game for their national anthem. We actually had 2 Chamber Leadership Dubuque presentations and tours in 2021. November was shown on the bottom left there. They were out on we gave them a tour, and that's out on the apron on our loading bridge. And I'll wrap up our events with the Captain Martin birthday celebration, which was held in the terminal last month. Thank you to all that from here that were able to make it. I got to see a lot of you. It was just great to have the family in attendance and talk about their father's accomplishments. Performance measures, Dubuque aircraft operations. An operation is defined as a takeoff or landing of an aircraft, and this includes all aircraft, commercial, general aviation, University of Dubuque, et cetera. For the second year in a row, Dubuque was the busiest airport in Iowa, with 77,568 operations. In the past, we've always been second behind Des Moines, and this year Des Moines had 74,551. But you can also see the impact that COVID's had on, for example, Cedar Rapids, Des Moines, and Chicago, especially Chicago. In 2019, they had just under 1 million operations, and they're still climbing out in 2021 at just under 700,000. Continuing performance measures are aviation fuel gallons sold the past 5 years. Graph shows aviation fuel only, so that's Jet A and 100 low lead. The blue column on the left equals gallons sold, and the green columns on the right equals our net profits. Our performance measures again, enplanements, which is the number of passengers that flew out of Dubuque. We went from 36,000 pre-COVID to 11,000 in 2020. In 2021, we were at 17,952. That was due to the reduction in flight schedule. Had there been 3 flights per day as there was in 2019, obviously those numbers could have and would have been higher. Load factors, or how full the aircraft is, we're at 62%. We show an increase coming out of the pandemic. The first 4 months of 2021 started off with low load factors. However, in December of 2021, Dubuque was at 75.2%. So continue to inch that up, which is a good thing. And of course, as you all know, Dubuque continues to have an excellent air carrier completion rate, and which currently we're just under 98% completion of flights, which is equal to or better than our regional competition. So we encourage everyone to visit our website at flydbq.com, call our toll-free 844-IFLY-DBQ for current flight status, traveler's aid, frequently asked questions, any other information related to the airport. As always, I thank you for your support and happy to answer any questions you all may have.
All right. Thank you, Todd, for that presentation. Adrian, we'll open for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, do we have any in-person input for the public hearing? How about virtually?
No virtual input.
Okay, all right. Then bring it back here for discussion. Yes, Ms. Rousseau?
Well, thank you. We are fortunate to have such a great airport and to welcome people to come to our community. So thank you for everyone who's out there. I noticed you had information about your solar array, and I wondered if you had any information about the savings that you anticipate having from having that facility.
Right, we don't have that now. We're currently working, and I can't remember the name of the company that we're working with, but basically what we're doing right now is we're submitting all the documentation for the FAA because there's a series of checks that need to be accomplished before you kind of move on to that next stage. So you have to make that, for example, there's what's called a glint and glare study. So we have to make sure when you put a solar array out there, it doesn't interfere with the pilots in the traffic pattern, getting a reflection. There's a height limitation study that has to be done, just again to make sure that none of the navigational instruments or anything would be affected by a reflection off those things. So we have the costs, we have the design, we have all that stuff, but we don't have the actual numbers yet. But that's coming very soon. And I'd be happy to share that with you when I'll be happy to share with City Manager to forward to the council.
Thank you.
You're welcome.
Mr. Resnick?
Yes. So is there a loyalty program at Fly Dubuque?
We used to have a loyalty program. We no longer have a loyalty program.
Okay. Because I know you're building up loyalty with Fly Dubuque first, and I know a lot of people would love to fly Dubuque, and you just keep improving the product like you have. It's a wonderful place, and I think there's a lot of Dubuque citizens who would love to fly out of Dubuque. So anything we can encourage that, to encourage that. So
we're hoping the loyalty program will rub off in our true cost calculator. So we have a true cost calculator on our website. And so if you see a fare disparity, so let's say it's, $300 out of Dubuque and $300 out of Dubuque and $200 out of Cedar Rapids. You can go into on our website to the cost calculator, put that information in, and it'll calculate your true cost of travel. So your free parking, your driving, even your time, if you want to even factor that in. And usually we're, at least in comparison with our, regional markets. So, and I should also mention too that I didn't put in our presentation, Life's a Feast is offering a grab and go in the morning. So I look at it as kind of a hotel concierge service where there's hot coffee, bagels, fruit, granola bars, there's sandwiches that you can warm up, and it's all a grab and go, and you don't have to just eat it in the sterile hold area. You could buy your coffee and your sandwich here for $7, $8 instead of $12, $15 in Chicago and still eat it in Chicago if you want. So, but we have the means to toast the bagels and, microwave the meal, the sandwiches and things like that, as well as, of course, sodas and all that other stuff.
We are flying to England in the fall, and Dubuque had a great price.
Good.
So that's good. So they had the least expensive price around. So I just hope people get to think about that when they're calling, because you guys have done a great job. So thank you very much.
Thank you, Council.
Thank you, Mr.
President.
Mayor.
Mr. Mayor.
Yes, Ms. Farber?
So thank you very much for the presentation, and I just have to, on behalf of the University of Dubuque, give you a shout out for the wonderful partnership, and it is greatly appreciated because we do have over 300 students in that pilot program, and based on your conversation and your research from the CEOs of all the other airline corporations, this is just great for workforce development. And I do know a few of the undergraduates from the University of Dubuque who have become pilots and who come back and share the good news and talk to us when we have our trustee and board meetings, and then actually recruit students as well for positions when they are on campus. So it's just a win-win, and thank you for helping the university and those students grow, because they are very, very appreciative of the facility, of course, at the Babka Center, but also the kindness that's extended by you and your staff, and it comes back in many, many ways. So thank you.
Thank you, Councilman
thank you,
Carver.
Mr.
Yeah, and that's a great program, and not only flight, but also management, right? So, and I'm happy to say that I think, I don't want to misquote, but at least probably over half of our full-time staff is University of Dubuque management graduates, so,
And they are appreciative.
yeah.
Thank you.
Todd, you share some great news every year when you come. You know, there was some really, I mean, the busiest airport in Iowa. We've talked about that over and over again. We saw a whole runway become a parking lot during the Field of Dreams game. So great news, but challenging news too. Are we doing everything we can is my biggest question.
Yes, so, I mean, that's a great question, and I hope and maybe I don't hope, but there should be 235 other communities that should be relaying the same message to the same similar communities. You know, this is a nationwide issue. It's really, do everything you can to support your local regional airport. Every passenger does count. We were even looking at, in the past, we used to say if we added, 10% load factors or things like that. We even kind of quantified that using with our air service consultant. If we could just add 3 more people per flight, I mean, that's doable. In the past, we've only captured 20% of our market. So COVID or not, if 80% we're not capturing, even if we captured a small percentage of that, would absolutely help. And whatever we can do to build the case for Dubuque, because, let's say Dubuque has a 75% load factor. That was good news pre-COVID. We were out talking to people about adding service, et cetera. Now after COVID, and there's so many more leisure travelers, so less business travelers, international travelers, 75 is, okay, you're average. And if somebody else has 80%, well, now the airline's got to figure out, do I want to take that pilot and fly out of a 75% load factor market, or should I move that pilot and that plane and take them to another airport? So that's why it's just so extremely important to support your regional airport, especially during these times.
Well, I thank you for doing everything you can, and I'm really looking forward to the marketing campaign. I think this is going to make a difference, so
I hope so.
absolutely appreciate it. Yeah, thank you. Yeah, Mr. Jones.
2 things. I'm glad you brought up the successfully completed flight statistic of 98% almost. You get a bum rap on that all the time. You hear it all the time. Well, the flights are always canceled. They just aren't.
Yeah.
They just aren't. They take off and they land where they're going. Day after day after day after day after day, and more here than most places. That's a message that we can't say loud enough, so I said it loud just now. The other thing is just a question. How is the nation coping with the, I'll say, self-inflicted pilot shortage?
Yeah. Well, there's a lot of discussion right now at a lot of the trade groups, your American executives, the ACI, all the trade groups. Everybody's trying to figure out ways, is this going to be should we be a congressional action where federal funds be induced to help, like a military style pilot training? I don't think, I wish I knew. I wish I had the crystal ball for that one, because we would all be in a better place, especially right here in Dubuque. It just kind of came down to, there was a pilot shortage pre-COVID. I remember even back in 2018, there was a couple articles Reddit wrote to the editor about the severity of what pilot shortage could be, and then COVID hit. And to receive funding, to receive the payroll support program funding, the airlines had to maintain 90% of their employees. So they couldn't let people go, but they could offer early retirements, things like that. They also suspended their flight schools, so the students that graduated from the University of Dubuque, now they couldn't go to that flight school, so they were kind of on hold. So, it just compounded the issue, and it's gonna take some time to dig out. This is definitely not gonna be a short-term fix. I wish there was.
I remember a conversation about one of the big challenges being an increase in the required number of hours
Yes.
flying an airplane to become a pilot. And I've trained technical professionals for decades in fire and emergency medical services. And you get a better paramedic by making him sit in the classroom an extra 10 weeks.
Yeah.
I get a better paramedic by assuring that their skills are secure, by securing their competency, by showing that they've mastered the skill and moving on to the next one. Yeah. And when they've got all the skills to fly that airplane mastered, they're done. Not say turn another 20 hours at an extraordinary cost to the student. And I think that's the challenge that we have to fix, is find a better way to train them. But I guess that's a little beyond the reach of the Dubuque Regional Airport.
Yeah. No, yeah, but it is. It's an industry issue. You're right, they changed to, it's called the 1,500-hour rule is what they call it. But there was one change made, and this was pre-COVID, but if you're an accredited college like the University of Dubuque, that reduces it to 1,000 hours. So that helps a little bit. But these students are still, they're graduating with 500 hours. So, especially with the cost of fuel going up and things like that, you're talking $100+ an hour and, that time they need. So you're talking on top of this education that they already spent so much money on, now they got to continue to spend more money to get those hours, just like you said.
They're spending
You
more
quoted it
money
very
to
well.
prepare themselves for that career than they are to be a cardiovascular surgeon, for instance. I mean,
Yeah.
the cost of becoming a pilot is exorbitant, and then the reward is kind of skewed the other direction.
At least starting out. It's getting better that way.
Well, I have been saying for a decade or two that we're about to find out how badly McDonald's wants the burgers flipped. And that's starting to apply to everything.
Everything.
We're going to have to start paying talent what talent's worth. So, thank you, Todd.
Thank
You guys are doing an
Councilman
awesome
Jones.
job.
Thank you.
I'll echo that. Thank you. Thank you very much for everything that you're doing. We know we're trying the best we can, so keep up the great work.
Yep. Thank you all.
All right, well, we're moving on. We're still at it here. So we've got our brand-new Office of Shared Prosperity and Neighborhood Support coming up next. So we'll let you get set up.
I'm just gonna get yours up here, and then you can adjust things. I don't know. That's scary. I can get you so far. Here's how you adjust.
I'm tall, so
You can pull this out if you need.
The kindness that they're showing.
End of December.
All righty.
Very good. Yeah, the city is very lucky.
So we have our Office of Shared Prosperity and Neighborhood Support. I'm not seeing any improvement packages requested, being quite new, so that's okay. We're looking forward to hearing hearing what you have to say here, Anderson.
Well, first of all, let me say thank you, Mayor and City Council, for your vision and moving us forward, especially during a pandemic. I also want to thank the city manager just for his leadership, personally and professionally. We all know that we have one of the best city managers in the country, and it's great to just learn from him. I also want to take the time to thank Geraldine O'Connors, who's not here today, and she's retired, but she's done a lot for just this department itself. She was the neighborhood specialist, and many of the neighborhoods right now are just so thankful for everything that she's done for them. And if you remember, before we became the Office of Shared Prosperity, we were an existing department that was focusing on the neighborhoods. But now we have a larger scope that also includes prosperity for every single individual in our community. And we want to share some of the great stuff that we're currently doing. But please be assured, there's a lot more work to do, and we're excited to continue the progress. First of all, our mission. Our mission is simple, is to work with the community to address, prevent, and reduce poverty. And when we think about poverty, it's just not for the individual, but it's also for the neighborhoods itself. And I'll never forget the phone call that we received after we said we wanted to be involved in this department. We were told, do not forget about the neighborhoods. And that was very loud and clear, and it touched us, and it was very important to the work that we do, because we truly believe in order to solve some of the complex things we're addressing and trying to deal with, you have to include residents, you have to engage the neighborhoods. They're the ones who have key solutions to the problems that they're dealing with every single day. And so it's loud and clear, don't forget about the neighborhoods. Also, in the work that we do in our office, there's 4 key approaches to our work. The first thing is leading by data. As you heard the assistant city manager last night, to be a high-performing organization or community, you have to have data. You can't improve what you don't measure. And so we take that to the heart. Again, we try to make sure that we have disaggregated data on the things that we're trying to solve. We try to make sure that we're facilitating and convening the right partners to make sure we're looking at poverty. We're nurturing, and we're also looking for new partnerships throughout the community to make sure everyone plays a role to addressing some of the complex issues that we're dealing with. It doesn't take one department. It's truly going to take every single community to come together, put their egos aside, and truly make Dubuque an equitable community of choice and invest. You'll hear it later on with Tim Wall, some of the great things that we're doing to invest in neighborhoods, and we're also encouraging our partners to do the same. Again, in order to solve these issues, we all have to put our time, talent, and treasures to the same end goal. So when I think about our department, I'm the director of Office of Shared Prosperity and Neighborhood Support. Remember, let's not forget the neighborhoods. I have the privilege of working with Tim Perry, who you'll get to hear from. What an amazing person. Originally, he was in the Human Rights Department. Of course, that department's name has changed, but he's truly been a blessing to our department. He's truly involved in the community, engaging residents, engaging businesses, and encouraging people to be a part of the solution, being a part of boards and commission, and that stuff matters when you have someone that you can talk to and walk you through the process. We'll have a data analyst, and you heard about this last night. This was originally approved in last year's budget for the city manager's department. Of course, it's been transitioned over to our department, and this person, once we get the job description, is gonna gather, pull data, review data, analyze, map data, bring it all for community partners to look and discuss and come up with some good action steps to track progress moving forward. When you're looking at poverty, it's not going to be an easy solution. And I remember someone calling me, and I won't tell you who, and they said, well, Anderson, you haven't solved poverty yet? And I said, well, you must not know too much about poverty. It's not a one-day solution, but it's something we're passionate about every single day. We wake up excited about this work. And we'll also have an administrator assistant who actually will start this Monday. And so we're super stoked to have this administrative person just to help us and make sure we're organized. Here's a visual of our amazing team currently right now. As I mentioned, I'm the director. Tim Perry is the community engagement coordinator. We'll have a data analyst, and our part-time administrative person will start Monday. Creating an equitable community of choice. This is something that's personally important to me and in our department, something we believe we're embedding in everything that we do. And we truly believe that when you look at poverty itself, poverty does not discriminate with race, it doesn't discriminate with gender, ability, with any demographics. But we also recognize when you unpack that data and you look at it from a different lens, it does impact our black and brown communities disproportionately. And no, we're not excited about that. It gives us a sense of urgency to really figure out what can we do different, not only on a local level, state and federal level. Whenever we attend any meeting, we always try to center those who are most impacted at the forefront, because we recognize when you do that, that has the potential of benefiting everyone. So again, when you center those who are most impacted, it has the opportunity to impact everyone. So let's talk about poverty. So when we look at poverty, this is the official poverty level at the 100% level. And so just to give you some context about that, when you look at poverty at the 100% level, this is an old way of looking at poverty, and it's taking into consideration of three things. Can people take care of the basic needs? Food, housing, clothing. But what the pandemic has shown us is that that's not enough. The basic things now that we take advantage of sometimes, technology, childcare, transportation. Do you have enough to even save a few dollars to travel? Or if something goes wrong, do you have something in the bank account to fix that? And so we are also looking at poverty at the 200 level, and that's called the working poor. There's people every single day who are working 2 to 3 jobs and still can't afford the basic needs. And so what we're doing with the community is trying to figure out what can we do to skill people up, to give them the education that they need. We have a lot of existing programs that are already in place, so it's not like let's start something new. It's let's enhance what we already have. And that's something we hear loud and clear from our friends from Greater Dubuque. Let's use the resources that we have and improve it, improve the practice, improve the system, the policies. As I mentioned, poverty doesn't discriminate. It does disproportionately impact a lot of our community members differently. And this is alarming to some of us. For some, you don't know what you don't know. For some, this is normal. This is reality. But again, with your leadership and the people that are at the table right now, this is unacceptable. And I was reminded a few weeks ago, I believe last week, with the president of Greater Dubuque Development Corporation, he mentioned loud and clear at one of our strategic plan meetings that we want everyone in this community to know that despite where you're from, where you live, if you're moving to here, you can be great in Dubuque. And so although these data are alarming, every single person that's in this data can be great in this community if we all come together, put our time, talent, and treasure together to ensure that they're successful. There is personal responsibility, but that also includes each and every single one of us. And so when we look at the numbers, these are things that we really can make an impact on. When you look at the numbers, this is not a large community. This is Dubuque. We're a mid-sized community. These are our neighbors. These are the people we go in the grocery store with that we probably don't even say hello to, or maybe we do. We have an opportunity to truly make a difference by engaging people, bringing them to the table, and asking what their experience is too, because the data doesn't share the full story. But when we talk to real people and ask what their experience are, we have an opportunity to make sure, again, everyone in this community knows that they can be great and they have everything that they personally need as an individual or as a community to be great. And so when we look at poverty with our neighbors, again, we're not happy where this is at. This doesn't tell the full story of Dubuque. And we know that when we come together, we can change this data point right here. It's only a few people that we have to really try to tackle, and that they're going to tell their brothers, their friends, their sisters, their communities. And we have some great examples down the road of just a few things when we engage people and include them in the decision making. They tell their friends, they tell their neighbors, they tell them their experience that they had. And so one of the things that we're going to do as I welcome Timwa to the table to share some of the great things that we've done in just in a few months. These are things that you've called us and you said you wanted us to do. Partner for a better Dubuque, right? You want to see more people engaged in civic leader, more engaged in the city process. You want to see us partner with the community to create opportunities where people can climb up the ladder, whatever that may mean for them. We're going to talk about some of those things that we've been able to do. I would like to invite Timwa.
Thank you, Mr. Sansey. I'd like to first say thank you to you, Mayor Kavanaugh, to the City Council, and also City Manager Van Milligan. And my name is Telma Peary, and I'm the Community Engagement Coordinator. And what I want to share with you is some programs that I've been able to kind of help facilitate and also offer within the community. And so one of those programs is City Life. So City Life is an opportunity for 25 community members to get an opportunity to actually interact with 19 different city departments. They get an opportunity to ask questions and also discover just exactly how their city functions and works, but also how they can get involved and engaged, okay? And so this program has been operating since 2013. And this has been offered in person, and we've impacted over 158 community members, which various amounts of them have actually joined either boards or commissions, neighborhood associations, and other opportunities that are within the community. And so something that happened within the pandemic was we were not able to offer this in person, as well as the slides going to the next one. Sorry. Here we go. We were not able to offer this program in person, so we had to get creative of how do we still connect our community to how they can get involved and engaged. And so we were able to actually start offering City Life online. So right now, I definitely encourage every single one of you, if you get to the time, go onto YouTube and type in City of Dubuque, City Life, and so you have an opportunity to learn about the different departments that we have, how they function, and also you have the opportunity of joining our next session. So currently right now, we do have the application is online, so you go to www.cityofdubuque.com/citylife. And so you have an opportunity for applying for this coming session that starts April 12th, okay? So for anyone that's out there online, highly encourage you to participate in that. So City Life is a program, again, that's working to impact 25 community members that are within the city of Dubuque. But we also were able to offer this Civic Leaders Program, and so this was working with Gina Bell and also Kelly Larson. And so what this was allowing for us to do is actual intentional outreach to historically underrepresented community members. So they can have the opportunity, again, to not only for us to be able to connect with them, but also share some education on how to be part of the actual civic engagement process, right? They had an opportunity of meeting with various city departments. They were able to ask some questions, and at the bottom left picture, what was really cool is we were able to actually have local and state officials be able to participate, and also the former mayor as well. And one of the coolest things was seeing everybody just being excited because some of them never had the opportunity of being in that close proximity or contact with a local or state representative. But the selfies were immense. So it was a really awesome time for everybody to just get that opportunity to connect, but also to feel seen as well. And so that was a 6-week program that we also were able to offer a stipend we had 21 applicants, 16 completed the program, and 4 of them were actually applied for boards and commissions. 3 were approved, and we have 1 currently pending as well. And in that program too, we do have a current candidate that's going for, whoops, I looked for where's that one? That's it. There it is. Yeah. Currently running for one of the wards. So that's really exciting, again, for giving people an opportunity to see how they can get engaged and make a difference. And so, again, as Mr. Stancy mentioned, what's really important is not forgetting our neighborhood associations. This is an opportunity for us to not only connect within our community, but for them to connect with their neighbors, to offer different opportunities to connect and build healthy and awesome relationships. Before the pandemic, we had quite a few of these associations that were active, but due to the pandemic, we don't have as many active. But our goal with our department is being able to get those back active, gain that interest, and get more participation within our community. And so one of the most important things is being able to invest within our community. And so our neighborhood associations have access to small to large grants where they're able to build their community. How do they want to see, what does community look like for them? And so our office has the opportunity of being able to do that, but to celebrate their neighbors and strengthen the neighborhoods around. Demonstrate individual, family, and neighbor and community pride through various programming and events that they are able to hold. Improve quality of life, because when you're able to know your neighbor and then go over and knock and ask for some sugar, totally helps when you're making your coffee and you just need a little bit and you didn't have enough. Also, important of being able to support neighbors that are helping neighbors, right? And so this is one thing that I'm really passionate about, and I'm really excited about this opportunity because one of the associations, our Point Neighborhood Association, they put on an awesome event where for Christmas they had a Christmas event, and I actually was able to attend, and also my kids, they had a great time, just able to connect and also get some gifts as well for neighborhood kids that may not have that opportunity. So those are things that create lasting impressions on kids, where they know that they have people within the neighborhood that want to get involved and engaged with them. And so they meet every first Tuesday at 6:30 p.m. And another event that they had was a hot dog event. So again, another way of being able to bring community members, their neighbors together, but what better way of doing that with food, right? I like to eat. Another department that, another neighborhood association is our North End Neighborhood Association. What was really awesome was we were able to connect and also put on an event where they had a neighborhood cleanup, right? And so this involved various even teachers, business owners, community members, neighbors that were a part of this to clean up their neighborhood, right? And to have that sense of pride of where they live around. And so we had 2 community members that were not actually familiar with the convivium at the time, but they wanted to put on something for the community to bring their friends and their family and their neighbors together. And so Frank Washington and Will Smith, they came together and created the Willy Wonka open mic night, right? And so this was an opportunity for those that actually, and they encouraged for those to attend the neighborhood cleanup in the morning, where they were able to get some breakfast with the convivium, again, talking about the partnerships, but they were able to get a golden ticket as well for admission for later on that night for the event. So we had a lot of different acts. We had some poetry, we had some dancing, we had a singer who I think some people threw some rotten tomatoes, but I was able to dodge a couple of them and caught one, ate it because it was grown from the ground, right from the convivium. So, but yeah, it was a great event and a great opportunity just to get people together and a diverse group of community members, right? So from young to old to you name it, they were all there. And I want to highlight for the neighborhood cleanup, there was over 200 pounds of trash that was collected, right? So this, again, the sense of pride of being able to go out there and clean up their neighborhoods, this was a huge opportunity for them. And just great community building and for people to walk out of their homes to be able to see that trash is no longer there. So the Langworthy District right now is currently meeting as needed, but a really awesome opportunity that was that they put on was being able to again access those small large grants of being able to provide some flower pots for their neighbors to beautify the area. So what's really important again is our community is powerful, right? In order to make Dubuque a masterpiece on the Mississippi, it takes all of us coming together. And so this event over here was a great opportunity. Again, Three Kings came together, and they actually, when you get an opportunity to hear their stories, they wanted to do something different for themselves, right? And so what they did is they attended NICC and was able to get some certifications from NICC. And because they did that, they inspired their friends, their family, and those around them to ask questions. Hey, so how were you able to do that? And because of that, the result was they wanted to put on not only the Willy Wonka open mic night, but here's another opportunity for them to actually meet with local business owners, ask questions, and try to find ways for them to get employed. So NICC, we had NICC representatives there educating on how their career pathways, also certification programs work, how people can get connected with that. But we also had businesses, local businesses that were in attendance as well. And so what was really powerful about that event was there was a lot of great questions that were answered, but as a result of that, one of the businesses actually opened up an interview opportunity for candidates that had some questions that may not have felt that they were able to apply, or for whatever reason. And so that resulted in employment opportunities for quite a few people that were in attendance. So again, this is an example of 3 leaders that just wanted to contribute and to give back within the community and created a very powerful event. And I should mention there are going to be some future events as well. So future initiatives, again, what's really important about our department is developing key metrics to address, prevent, and reduce poverty. And how we do that is through informing not only the community, but our partners and other organizations, facilitate and convene, again, partners within our community, and initiate and invest, right? Really important for us to also invest. And so right now what we're doing is working on hiring for our vacant positions for our administration assistant position, our data analyst position, and on the 18th, or not the 18th, looking to move onto the 18th Street location on Central. So, and what we're going to continue to do is work to increase resident engagement in the city government process, as well as continue to partner with community organizations and other partners to be able to provide community members with that upward mobility opportunities and empower everyone across all demographics. So again, we currently don't have any improvement packages currently right now, but as our department develops and the work that we do, we'll be looking at different options and things that kind of open up as we progress. And so here's just a breakdown as far as our department's budget. And so as you can see on the slide there, and so that's just on average of $5.70 for our community members. So with that, again, I just want to thank you so much for this opportunity and time, and if you have any questions.
All right, thank you, Anderson and Temwa. We'll open for public comment first, so Adrian, you can go ahead with that, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
Okay. Do we have any public input, either in person or virtually?
No virtual input.
Okay. Then we'll bring it back to the table for discussion.
Mr. Mayor.
Yes, Mr. Sprank.
Thank you, Mr. Mayor. Thank you, Anderson and Timwa. I get the lovely pleasure of seeing you guys twice a month at two of my neighborhood association meetings. And the neighbors are always happy to see you guys. They're always happy to see that you can help them give them help get grants, provide information, be a bridge. So I'm excited to see how farther your guys' department can go. And I'm really excited when you get your new office. And I think you're going to see a lot more people just coming in looking for help. So thank you, guys.
Well, it's really kudos to you guys, and I go back to the comment we heard where don't forget about the neighbors. And so we heard that loud and clear. It's a privilege to serve the neighborhoods. And even when we think about the building on Central and what Tim also was going to say was that is the place for the community. Central is downtown, the heart of Dubuque, and as we get things up and running, neighborhood associations, you can use that space because that's your neighborhood, right? When you're thinking about creative ideas on things you want to solve, that's your neighborhood right there. And so you're going to see a lot of foot traffic because Tim again, he's just out in the community and he's poking on everyone to be involved. So, but kudos to, it's really the leadership of you guys on that one.
Mr. Mayor.
We'll go with Ms. Roussel first.
Thank you. Thank you. And it's so exciting to hear about the work that you have going on. And when you said, as Greater Dubuque says, you can be great here, how wonderful to think that everyone can be great here through the work that you're doing. I noticed in your goals under the first one there, it was just says to reduce poverty. And there isn't a target there. I wondered at some point, will you determine a target?
Yes, so that is the long-term goal, is to work with the community to identify what are the specific things that we can do to track true progress and moving poverty downward. And so, yes, that is a goal for us.
Is that all you have, Ms. Roussel?
Ooh, yes, thank
Okay.
you.
Yes, thank you.
That's what I
Mr.
need.
Resnick.
Thank you very much. And I'm glad you mentioned about the neighborhood support. When I often when I see this position, it's just pared down to Office of Shared Prosperity, and you've probably seen that maybe written or talked about. And I'm not a big acronym guy, but shared prosperity and neighborhood support is spans, right? And I love what it says, from end to end, you extend or you reach across. I think this is to bring everybody together. So I personally like spans and to think about shared prosperity and neighborhood support. So I like that. You know, what I get from, you're brand new, people don't know what's actually going to happen, and you're looking at lots of different options. I'm sure you've heard a lot of suggestions about what you might do, because it's just a huge topic. Sometimes we heard in the elections or when we go out that there should be reduced poverty just because there's more work to be done and the wages are up, and it's just some people don't have a willingness to work. Now, of course, we know that that's a small view. I mean, we know there's impediments like childcare and so many other things. But the question is, does that help? That the area is improving as far as number of job openings and how much the rate of pay is getting higher. Is that going to make your job easier, or it's not?
I think that's one piece, but do people have access? So that's when we look at it from an equity standpoint, right? There can be many jobs with good paying, benefits, but if people from the community are not aware of it, then we're not really doing the work that we should be doing. And one of the things you heard from Timwa is, as he is involved in the community, engaging the community, is just creating awareness also. Like, hey, did you know these things are available? And for a lot of people, even when we think about what happened with Opportunity Dubuque, with NICC and Greater Dubuque, many of those citizens who participated had no idea that NICC had all of those services for free right now. We have a great opportunity right now to support so many people, help so many people, and it's free. But they had no idea, and the comment was, well, how am I supposed to do this when I have 2 to 3 jobs? Can anyone help me to understand that? And NICC and people are brainstorming, well, hey, if you come in and you tell us what your needs are, we also have services that can take care of some of those things. So childcare, we have money for that. Payment for rent, we have resources for that. And it's like, whoa, I didn't know that. So it's really making sure not only the resources are there, but people have access to those resources.
Yeah, great, thank you. And finally, I hope that you extend an open invitation to the nonprofits to visit with you for updates and partnerships, because I know that being involved with a nonprofit right now, I'm going to give you a call and talk about the possibilities and others that we can be in partnership, and we can really come together as an entire community and see if we can do what we can to make this situation better, this shared prosperity and neighborhood support, something that the entire city can get involved with. So I want to thank you very much. I'm really excited about this position and you in it particularly, and all the different things that can happen and I'm sure will happen. So thank you very much. Thank you, Mr. Mayor.
You know, did you want to address the point that he made about partnerships with nonprofits?
Yeah, so one of the things that we intentionally do is we try to meet with different community partners monthly, and we're going to ramp that up where we have quarterly meetings with a variety of key partners. And as you saw in our third pillar, initiate, nurture existing, so we want to make sure we have those relationships and look for new relationships. So we're always constantly trying to meet with people because it's all hands on deck right now. And we do have council members also who include us in different meetings and invite us to come present to their association or community organization that they're involved with. So we welcome any invite to come and present, talk, especially around data, what you are doing and how we can align efforts.
Thank you. Good points. All right. Well, you're not kidding that you're everywhere, because I feel like every time I go somewhere, one of the two of you is there. It just seems like I walk into a coffee shop, there's Anderson having a conversation with somebody that he's building a partnership with. I go somewhere to some community event and there's Temwa. In all kinds of places. I mean, it's just, and that's literal and figurative, because the fact that you pointed out, what you're trying to do involves all of us. It involves every single city department. It involves everybody in the community. It involves all kinds of different organizations. So I very much appreciate the scope that you have tackled so far and the things that you're doing, and really looking forward to seeing some of these indicators next year when you come in front of us again. So thank you very much for the presentation tonight.
Thank you so much.
Okay, we will move on to the newly named Office of Equity and Human Rights. So we'll take a moment here and switch over. You look like you're ready to go, Collins. Yeah, thanks. Feeling good? All right, so we have the Office of Equity and Human Rights here. We have 4 improvement packages requested. We have 1 recommended, and I will turn it over to you, sir.
Thank you. Well, good evening, everyone. My name is Collins Ebo, Organizational Equity Coordinator with the City of Dubuque and Interim Equity and Human Rights Director. Tonight, you're going to hear about changes that have occurred in our department over the last year. But I want to emphasize, as many have done tonight and in previous nights, that our work, our collective work, and these changes have not impacted our core mission, which is focused on serving underrepresented communities and addressing racial, cultural, language, and structural barriers that impact the ability their ability to thrive in the city. Excuse me. Now that's reflected and that's expressed in our mission. to advance social justice, racial equity and human rights in city services, and civic engagement through education, analysis, outreach, and community partnerships. Now, this slide shows you the prior structure of our department for full-time staff, including myself. And this shows you the current structure of our department that reflects a bit of that change that I mentioned before. Our office was renamed the Office of Equity and Human Rights, and this was done to better reflect the services that we provide and the advanced work that cities like our own have done to center equity in service delivery and analysis of employment and community outcomes. I'll touch on this work later in the presentation. Second, Temo Perry, our Community Engagement Coordinator, has moved on to the Office of Shared Prosperity and Neighborhood Support. And Kelly Larson, our past director, has moved on to a Training and Development Specialist role with our Human Resources Department. And with this, I wanted to pause to recognize her outsized role in working to make our organization a better, more inclusive place for employees over the years, and the work in our community to recognize how, where, and why this work is essential for our community's future. And as you see it now, our current director position is vacant. This explains our evolution and some of our past transition over the years, this slide, that has led to the creation of new positions across the city. But overall, this is a reminder to us that the work to advance equity and human rights is a shared responsibility across multiple sectors of our organization beyond a single department. And so from our city attorney's office to human resources, the Multicultural Family Center, police departments, Office of Shared Prosperity, and beyond. We all work under this umbrella mission of creating a culture where human rights are realized and where each person can thrive. A lot of different cogs in the wheel, so this isn't something that we claim to own within the organization. Of course, this work is aided by our Human Rights Commission, chaired by Mallory Gardner. And to jump straight into our highlights from the previous year, of course, like every department, we continue to respond to the pandemic, and that response included responding to community concerns. And so we convened 3 virtual health panels made up of medical experts and community members from our Black, Marshallese, and Asian residents. Share some of the metrics behind some of those engagements as well. So our equitable fine and fee assessment work continues and has progressed to active work groups in the areas of animal control, diversion, storytelling, and a utility billing rate study. And as well, this work is informed by our continued partnership with the Fines and Fees Justice Center and San Francisco Justice Project. We'll soon revisit community engagement through surveys, focus groups, and more to, again, better understand the experiences of our residents. Finally, in looking back to 2021, the work of this office includes, coaching, research, and project management of equity initiatives across the city. But of course, again, this work is not done alone, nor can it be effective without this fundamental and foundational understanding of quantifying equity and what that means when designing a project. And so we and 13 departments participated in a Foundations of Data Equity training with a firm, data science firm, We All Count. And we're continuing to really use a lot of great resources from that training. Our SRO work group continues, and our department continues to facilitate those meetings, and recommendations to the Dubuque Community School District as well as the City Manager's Office will be completed soon. Finally, the Memorandum of Understanding with the Dubuque Community Police Relations Committee and the NAACP was updated and is being finalized by our City Attorney's Office. Our future initiatives include creating and continuing to create a equity indicator dashboard. You know, the other night, Nikki Rosemeyer, our GES specialist, expressed her encouragement, her excitement for departments that think a little bit differently when it comes to displaying data for public consumption, and how proud she is that Esri and these other cities from across the country have looked to our application of data to help solve these community problems and these shared issues that big and small communities like our own have. So creating such an indicator dashboard in the view of our department is for the purpose of connecting department level indicators and initiatives actually from department level equity plans to a map for the public to understand the conditions at the neighborhood level, and to quantify how our efforts are making a positive difference. Our Municipal Career Pathways work group is continuing to work to expand opportunities and address barriers and identify barriers for high school and college students to be exposed to and eventually work for our organization, so that internal work of building capacity to foster that next generation is continuing. As well, our ICC team, our intercultural competency facilitators and trainers, people made up of volunteers from various departments, recently completed strategic planning for our internal as well as external trainings on racial equity and intercultural competency best practices. And that strategic planning resulted in us expanding our offerings, well, soon to be expanded offerings, to teach and again raise awareness surrounding equity and civil rights afforded to the public and employees. In practice, what does that mean? That means trainings around bias interruption, LGBTQ awareness, workplace equity, and working with even the Dubuque County Disabilities Council to identify ableism and the concerns of those living with disabilities. This slide, of course, excuse me, gives you the total cost of our department, which the average homeowner's property tax cost is $6.48. And this slide is kind of a return back to the service areas that I've mentioned. And these are kind of the basic areas of what we do. We continue to process human rights complaints and intakes and inform the public on their basic civil rights. We promote and measure equity and inclusion in city operations and amongst our employees, researching high impact practices from our peers around the country and even around the world, from the both public, private sector, as well as placemaking community-centered approaches. Training in departments on using race and equity toolkits and lenses to review policies, programs, and services, and overall, in really in an interconnected way, working with the community, residents, community-based organizations, volunteers, to center data and voices of the most impacted to co-create those solutions to advance equity and advocacy. We see this work as interrelated. Yeah. We have one decision-making package, or decision package that was recommended for approval. And this comes in the form of an all-community reads activity around the book, The Sum of Us by Heather McGhee. It's 2023, and there continues to be this divide amongst people of different racial and identity backgrounds in our country, in part because of this zero-sum paradigm idea that so many people buy into.
And I guess we're done.
Maybe I'll move more.
The lights just turned off for anybody at home. They're back on.
Okay. But to go back to this issue of this zero-sum thinking. This zero-sum thinking is this thinking that divides many of us, that so many people buy into, the idea that when some make progress, then some and then others must lose out. This continues and contributes to the divide that we often see when we address inequities amongst us all, when we talk about policy and practice. So McGee's book holds up examples of ways in which social problems can be addressed through collaboration and coming together. Racism is noted as one of the 8 determinants, 8 determinants of poverty in the Equitable Poverty and Reduction Prevention Plan. And so this project will help move the community towards an improved understanding of race in America and the importance of working together to advance racial equity in Dubuque in ways that benefit everyone, that, again, do not need to come at the expense of any particular group. This is we continue to, at this time, focus our goals and performance measures on mainly kind of internally focused initiatives of increased understanding of equity application and individual difference amongst employees, their growth and understanding after attending various workshops, of course, our demographics amongst our board and commissions, and departments developing their own equity plans as well. These performance measures may change in the future, so I'm looking forward to discussing this in the future with you all as well, too. With that, questions or comments? And I thank you for your time.
All right. Thank you, Collins.
You're
We
welcome.
will open up for public comment first, please.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
Okay, do we have any public input in person or virtually?
No virtual input.
Okay. All right, I'll bring it back to the table for discussion then, please.
Mr. Mayor?
Yes, Ms. Farber.
Yeah, thank you for that presentation and very much interested in learning a little bit more about the Some of Us program and how the outreach will be, or what the program or the project will be to share this information and to talk about this story.
Yeah, so the idea is less of a program and more of a series of discussions around various topics within the book. So much like our last all community reads discussion on a book called Picking Cotton, discussions like that would go into a group and communities discussions around the Some of Us are how do you see this in your day-to-day? How do you see this connected to various state and local level policies or advocacy? So it's in development. I think it would be premature to go into the specifics about the program itself or the book discussion itself.
Any chance the author will come and have some of this conversation?
That's part of the number behind that decision package. That's a major number behind it.
I'll look forward to it, and hopefully we
Price
can
tag of the
attend.
decision
Yeah.
package. Yeah.
Thank you.
Yeah, go ahead.
I hope I'm not interrupting.
No, not at all.
It relates back to that question. So when department managers submit their improvement package request, for instance, these are numbered 1 through 4. Actually, number 1 is the department's top priority, and number 2 is next, and number 3 is next, and number 4 is next. And potentially, you could help me correct maybe an error of my ways in this particular recommendation for this department and help achieve the item you were talking about earlier tonight. But, so for instance, if instead of funding improvement package number 4, which is a very worthy project, by the way, but has a cost of $66,500, if we were to switch it to funding the first 3, so would get 75% of the request instead of only 25% of the request. The first 3 combined only cost $35,422, which that savings of $31,000 would get you a third of your way towards funding your health position. Wouldn't get you all the way, but a third of your way. And the department would actually get the three things they prioritized higher than the fourth thing. Not that the fourth item is not very worthy, so I'm not certainly meaning to suggest that. But I have to admit, I was enamored with the success of the Picking Cotton experience, that community conversation, when I recommended this. But actually, as I was sitting here listening to his presentation and reading the improvement packages, I thought, I probably should have recommended the first three and not the fourth one. And anyway, so it's just a thought. And it seems to serve the department and the community at the same time as getting you closer to your goal. And if that ends up happening the last night, which maybe it doesn't, and
Okay. Well, let's stick with that for a second. I appreciate you bringing that up, Mike. I have a question first, though. When we did the Picking Cotton community reads, who funded that? Was that the city that funded that, or was that a different funding source?
I think it was a grant, wasn't it?
It was a grant, and that's a better question for the library.
I think it was a grant and a combination of one of their trust funds, maybe, supported it.
Okay, but so it wasn't funded in this particular mechanism the same way? Okay.
No.
All right. All right, so I'll open it up for discussion then on the point that Mike is making here.
Mr. Mayor?
Yeah, Mr. Resnick.
I would love to hear Mr. Ebo's reaction to that, because it's kind of maybe a surprise, and so I'd like to have your input on that as well. Would you rather have, is there a druthers that you have? I'd rather you do one thing or another. Do you have a comment on the city manager's suggestion?
Many comments. The short answer, yes. Focusing on or having funding the prior three improvement level requests would still advance this office's mission, which includes community engagement, which includes people focusing on their individual identity and how that impacts the world and the systems around them. So that's a longer answer. Maybe a little bit longer answer is that I welcome re-examination of the prior three decision-making recommendations, and those would enhance the capacity of our department. And again, as this work has continued and advanced and progressed within the city of Dubuque over a number of years, we grow and then we shrink because another department, good on them, finds it within themselves to prioritize this work as in centering of their own department missions. But we're always left needing to plan for tomorrow and work the resources that we have. So yes, these prior three packages directly address our capacity, or recommendations, or requests, address our capacity, and I welcome maybe questions or discussion on these, or reconsideration on these things as well, too.
Okay, well, thank you for that, and maybe as the mayor kind of talked about, maybe we can get that other project done with some partnerships that helped with that first book that you mentioned. So that might still be a possibility in some way because of the possibilities that you both mentioned. So I just thank you for that. And are we talking about this question first, Mr. Mayor?
Yeah, let's stick with this if we could, and then we can come back, sure. Yeah. Other thoughts? Mr. Spring?
Yeah, I like the idea of approving 1 through 3 in lieu of 4, so.
Okay.
Sure.
I'm seeing heads shaking all around. Yeah, okay, and I agree as well. So, Mike, thank you for the suggestion, and we can plan on, I guess at this point, kind of holding that for the separate discussion for the last night, and we'll put that on the list as well. And thank you very much, Collins, for your input on that too. So, Mr. Resnick, I think you had something that you'd like to follow up
Yes,
with?
I just wanted to say, I really do hope that we get the Some of Us project going as well. I think that's great. Of course, in this day where, a lot of people are trying to divide us as a people, the United States of America, it's a big job, to take what's currently perhaps the divided states of America and try to bring us together with this common sense approach. It's not either or, but we build on each other, right? And I always thought that that was kind of an accepted principle, and it's just kind of disheartening to see all the separation that people do, this, cutting us up as a people. So I'm really hoping that we can do something with that number 4 as well, because I think that's a great project. Those are my comments, and thank you, Mr. Mayor.
Thank you. Other thoughts or questions? Well, I actually have one question for you, Collins. First of all, thank you for everything and that you're working with. There are a lot of changes for your department this year, and we've recognized that. I think in some ways some very positive ones, and I think that there's still growth to be had, especially now that we've kind of moved in a different direction than you probably expected when you first walked in the door tonight. So, but a question that I have is, I noticed that this idea of departments that have equity plans written, and we've been at this 75% level for the last couple of years. Can you give us a little more information on why some departments don't have an equity plan yet?
Yeah, I'll say that our department made a pretty outsized pivot to address the needs of the pandemic. And though the work to still research precedents across the country that are applicable and actionable in our community still was ongoing, to have not sunset, but have a sunrise to equity plan to go through our evaluation process and to have active discussions with our city manager to make sure that they're addressing our city priorities and actionable within 1, 2, 5 years, et cetera. That's a bit, I guess, to add the degree of like why that level has stayed the same. The research has continued, but with this transition, it's been both pandemic as well refocusing, I'll say, the definition of what an equity plan is, where maybe a majority, I won't say a majority, maybe a number of those completed equity plans didn't meet our standards of what outcome-driven plan is, and it was more outputs. It was more.
Sure.
It would be nice too. It would be more. It was more. We are increasing our outreach to and increasing awareness without specific, actionable, measurable, measurable goals. So with that, the now in development, but working with departments to apply their old equity plans through a new template that is discernible, that's actionable, that's quantifiable, and easy for the members of the public to understand data and their outcomes. That's the ongoing work that we're doing. And at the end of my presentation, as I said, that those performance indicators are apt to change in the short term. That my explanation about the equity plans really informs that opinion. So in short, we've been stuck at that number because we're redefining what that number means.
Got it. Well, that's actually encouraging. I was a little discouraged when I saw that, and considering the fact that we've been talking about equity in pretty much everything that we're doing here, but I'm encouraged by the fact that we're actually just trying to do it better, and that's the reason for it. So good to know. Okay. All right then. Well, thank you very much for all of your work, and thank you for taking on the extra work as you've made this transition as well. So thank you for your presentation tonight.
You're welcome. Yeah, thank you.
Okay. We will move on to our. Well, I'm going to definitely say last but not least on this one, Finance Department. So we'll let you get set up there, Jenny, and then we'll start in.
A very riveting topic to end on.
We're experts by now, right?
Right. Maybe you could give the presentation.
I'm not offering that, no. We'll take a quick second, take a breath here, and then we'll get started, okay? Losing everything already. Okay. Well, we have the Finance Department, and we have Jennifer Larson with us. We have 4 improvement packages requested, and 2 of them are recommended, so go for it.
All right. Good evening, Mayor and City Council. Jennifer Larson, Director of Finance and Budget. I will be presenting on the Finance Department. So last fall, we actually had some finance staff volunteer to work with an outside consultant, Michelle Ganida from Dale Carnegie, and they actually wrote a new mission and vision statement for the Finance Department. So this is actually new. So our mission statement is the City of Dubuque Finance Department promotes excellence internally through all-encompassing communication, support, and teamwork, and strives for authentic connections between unique individuals to create harmonious service to our citizens and coworkers. And then they also created a vision statement which says to create an environment that is inclusive, transparent, accessible, and forged by clear communication, providing dependable customer service in a fun and enjoyable environment. We are unique and we are Dubuque, so this was created by finance staff. So these are our new faces that were hired since the last time I presented. So we've hired 5 new people going back to March of last year. So we have a new account clerk, Hunter Smith. Jacob is actually not brand new. He was a finance intern, but he has been hired as an accountant, and he'll go full-time when he graduates from Loras in May. Jason Clausen was hired as a budget financial analyst, and then Chris Valet was hired as a cashier, and then most recent was Robin Hosh, also hired as a budget finance analyst, started on February 1st. So we do have an investment oversight commission, and I'm excited to report that we have, for the first time in about 3 years, no vacancies on our commission. We just filled 3 seats. So this commission actually meets quarterly, and they review the city's investments and all the money manager decisions and make sure that they are in compliance with the city's investment policy. And then they also make recommendations if there's any changes that are needed. And we also have our money managers come in and give presentations each quarter to the commission. So it's a great group to work with. This is our current organization chart in the finance department before improvement packages. So we have 20.26 full-time equivalents. And we have 1 improvement package to increase finance intern hours by 0.25 FTE, which would increase our full-time equivalents to 20.51. And then I'm just going to take a second here just to thank my staff for all the work that they do. There's a tremendous amount of work output that comes out of the finance department each and every day, whether it's budget, accounting, utility billing, and of course we also provide a lot of customer service to those utility billing customers. And then I'd also like to thank what I consider my leadership staff. So actually Rose Horner is here tonight. She's the utility billing supervisor. I have Assistant Finance Director Cassie Ross, and then Tony Breitbach is the Purchasing and Risk Manager. So without them, it would be very difficult to run the department.
And Mr. Mayor, I'm going to interrupt Jennifer's presentation here, if you don't mind. So, you know, we had public health earlier, Mary Rose, and we all know the great job she did through the whole pandemic. And when Chris Coleman presents in information technology, you know, having 100 people work from home overnight, and then, of course, we got the obvious stars of our first responders and the sacrifices and the work they did. But the finance department behind the scenes stuff to make us survive the last 2 years with all the grants and the people that weren't paying bills and couldn't pay bills and needed help and how to get them help. And it's something that nobody saw. And our community would be a different place right now if it didn't happen. I guarantee our organization would be a different place. And even with staffing issues that happened during the pandemic, it just saw 5 brand-new employees that did finance, and utility billing, just did a fabulous job.
Thank you, Mike.
Thank you. Moving into creating an equitable community of choice. Under budgeting, we actually apply a lot of equity lenses when we go through the budgeting process. We have departments look at equity when they submit their capital improvement projects and their improvement packages. They answer equity questions related to those. In the fiscal year 23 budget process, we had assistance from the Office of Equity and Human Rights in creating a department equity overview question, which is at the bottom there on that slide. We also hold equity and budgeting training annually for departments to help them understand how to best budget for equity. As far as our grant, contract, and purchase of service partners, we've created uniform applications for funding, as well as contracts where that incorporates equity questions and goals in those contracts and applications. And then we also provide various platforms for residents to participate in community engagement, whether it's in person, hybrid, or online tools. Under finance, we do have an equity plan. We are developing opportunities for minority business enterprises to participate as a City of Dubuque vendor or contractor. Tony Breitbach is a part of that group, so they are developing an ongoing list of local targeted small businesses in conjunction with the state certified targeted small business directory for city procurement. With our new enterprise resource planning system, we will be able to track vendor demographics and other data related to procurement. We are also evaluating insurance requirements to ensure that we're not limiting procurement and for vendors, and then also providing outreach assistance to aid vendors in understanding coverage requirements. And then that group is meeting quarterly to discuss opportunities and outreach. Under utility billing, we started offering payment plans after the pandemic for customers with delinquent balances since March of 2020. We also have water, sanitary sewer, stormwater, and refuse 50% base fee reduction for income qualified. American Rescue Plan Act funds assistance is being provided for delinquent utility bills from March 2020 billing cycle through the end of June 30th, 2021. We also suspended late fee charges from March 2020 through January 2022 and water disconnections from March 2020 through August 2021 due to the pandemic. Rose Horner also participates in the Equitable Fine and Fee Reform Group. And then heading into 2022 highlights, a major accomplishment we had is we established an indirect cost allocation plan, and it was approved by the U.S. Housing and Urban Development Department in December of 2021. So that established an indirect cost rate of 40.07%. So this allows us to claim indirect cost rate on any grant that would allow it. Not all grants will allow a percentage rate as high as 40.07%, or they may cap a dollar amount as well, but it gives us an opportunity to claim some grant funds that we may not have been able to claim before. We are also looking at going back to grants all the way back to 2019 to see if there's any unclaimed grant funds that we can now claim using this indirect cost rate. And then it can also be used as an in-kind match for future grant applications. So there's a lot of benefits to having that indirect cost rate. Other highlights, of course, we're working on our enterprise resource system software implementation. We negotiated our contract with Tyler Technologies, and now we've been working on implementation for financial, budget, and human resources. We also received GFOA's Certificate of Achievement for the fiscal year 20 annual comprehensive report, which was the 33rd consecutive year. And then we're doing Dale Carnegie change management training. We started in December. It will go through April. Moving into utility billing, some highlights on things customers are enrolled in. We have seen an increase in paperless billing, auto pay, phone and online payments, WaterSmart registered users, especially after the pandemic. A major increase in WaterSmart registered users, increasing 11% there. And then some statistics on the stormwater, refuse water, and sanitary sewer reduced base fee. There's about 2% of our customers signed up for that. And we have about 24,302 customers. Those reduced base fees, the general fund does fund those, and they totaled just over 113,000 in fiscal year '21. Just giving a snapshot of the utility billing assistance provided through February of 2022. We've assisted 783 accounts, providing almost $400,000 in assistance through the various programs. The only one on that list that is no longer available is the State of Iowa Disruption Prevention Program, but all those other programs are still active. This slide shows delinquent utility balances through February 2022. The green line is mostly pre-pandemic. Blue line is pandemic 2021. And then the orangish line is 2022. You can see in February in 2022, the delinquent balance is coming down. We did reinstate water disconnects for non-payment in August, and then late fees were reinstated in January. We will also be restarting tax liens against non-payment as well, so we'll see probably some more reduced balances there. Other highlights, utility billing staff works with various agencies to provide financial assistance to customers on their bills. We have now outsourced utility bill printing rather than printing in-house. And the utility billing staff is also participating in the Dale Carnegie Change Management Training. Under budget, we did hold the annual department training. That includes budget, finance, and information services. We completed the 23 budget recommendation with limited staff. I would like to give special thanks to Assistant Public Works Director Ariel Swift, who also helped out on the budget financial analyst Nathan Keller, who actually is our grant-focused budget analyst, but he volunteered his time with us, and budget financial analyst Jason Clausen, who started under fire right in the middle of budget. So we did receive the GFOA's Distinguished Budget Presentation Award for the 22 budget, so that was our 16th consecutive year, and budget staff is also participating in the Dale Carnegie Change Management Training. So future initiatives, finance, of course, is busy with the Enterprise Resource Planning System. We go live in July, and Tony Breitbach has started a countdown, which has been very stressful, but we have enough time, but I'm sure we'll get there. So part of that planning is we will need to begin user training in April and through June before we go live. And then, of course, we'll provide training ongoing for departments and our own department. Another future initiative is a new GASB 87 for lease accounting implementation. So it changes how we have to report leases in our financial statements. So we're working in conjunction with the legal department, and we've also purchased lease software to allow us to make that accounting change. And we're continuing staff development. Under utility billing, they will begin implementation in April for their module for utility billing in the new Enterprise Resource Planning System. Their go live is August of 2023. They're continuing to reduce delinquent utility balances, through those financial assistance programs, payment plans, resuming tax liens for unpaid owner accounts in March of 2022, so later this month, and then also resuming turning unpaid tenant final accounts over to collection in March of 2022. So those haven't been done in over 2 years, so it's been a while. They are also working on implementing paperless meter work order system with water distribution staff, and that was made possible by Tony Steffen and Information Services, leveraging some software that we already have, and continuing staff development there. In budget, we'll continue to expand budget engagement, also work in equity with equity tools and measures in the budget process. We'll have a lot of process improvements to do because of the new enterprise resource planning system. Fiscal year '24 will be the first budget year we'll do in the new system, so we'll be writing new reports and everything for that system. The property tax support for the finance department is $13.47 to the average homeowner. This is a list of financial services provided by the finance department. And specifically in utility billing, we bill for water, sanitary sewer, refuse, and stormwater, and there's over 24,000 meters in service. And then just a plug for the WaterSmart portal. It's a great app if you haven't signed up for it. It can alert you if you have a leak. You can pay your bill online, so it's a great thing to check out if you have not. And just another screen on that, leak alerts, paperless billing online, and auto pay. Some online tools available in the budget office. We have Open Budget, Balancing Act, Taxpayer Receipt, and then in the last year they added prioritization, which we used in City Life, which worked out really great. And this just shows some statistics on the page views in Balancing Act. So we did have an uptick in 2023, increasing to 255. We have one improvement package recommended, which is a seasonal summer finance intern at a cost of $8,417 and 0.25 FTE. Under performance measures, we added a goal on track, which is number of utility billing customers using direct payment. We've seen a tremendous increase in customers using auto pay. And then just to mention all the great online tools we do have available on our website, dollars and cents, Open Budget, Balancing Act, Taxpayer Receipt, and Open Expenses. So great tools to check out. And that's it, if you have any questions.
Okay. Well, we will first open it up for public comment.
At this time, anyone participating in the meeting in person who would like to discuss this public hearing may approach the podium when the mayor asks if there is any in-person input for this public hearing. For all remote attendees, please enter your name and address in the chat function and state your question, or state your name and address over the phone when the mayor asks if there is any virtual input for this public hearing. Please begin your input by stating your name and address.
All right, like I said last night, this is where we see who's still partying with us. Any public input?
No virtual input.
No virtual input. Okay, nobody here. I'll bring it back to the table. Mike, I saw you talking over there. It happened to be about the fact that there are actually two improvement packages. All right, you want to talk, that first one is actually recommended, right?
Yes,
Okay.
I missed that one, yes,
okay.
sorry.
Yep, I was going to ask about that, so we'll start with that.
Okay.
Congratulations. All right. Any discussion or questions for
Mr. Mayor.
Jenny? Yes, Mr. Sprang.
Thank you. Question, Jenny. During the pandemic, when you had staff working from home, people were having to field calls, so they were running credit cards. And there was a surcharge fee that was added to folks' to citizens' bills, unfortunately. And is there any way we can bypass that surcharge fee? Because that's just seems, I know we're a municipality, so we're not a business, but is there anything we can do about that?
So as part of the new enterprise resource planning system, we're actually looking at that and we're putting data together on, because some departments absorb the fee because of their funding, they can't, charge the surcharge, but other departments like the finance department charge the fee on the credit card. So we're actually setting up a meeting with the city manager to discuss that and see what his recommendation will be after he sees the data. But that's something we're looking at as we're implementing the new system.
I had a number of seniors that were just like, that were frustrated with it because they're like, I just want to pay my water bill. I'm like, I know you want to pay your water bill, but you have to use your credit card. And they were just frustrated, and I was hoping, and once City Hall was back open, they were like, oh, problem solved. But it's just something I was wondering about. Thank you.
Yep.
Mr. Mayor?
Yeah, Ms. Farber.
So I wanted to thank you for your presentation, and then also thank you for engaging college interns for the summer, and hopefully this is an earn-to-learn opportunity, and I noticed that you're hiring one of them full-time, and I think that the universities in particular are very appreciative of the opportunities to have these kind of internships, and they really do look forward to not only learning and engaging in a potential future career, but actually when the offer comes, they're just totally delighted. So thank you for that partnership.
Yes, I'll just put a plug in that we're hiring 2 interns now, so if anyone wants to send some our way, we only had 5 applicants, so.
On it.
Okay.
Thank you.
Any other questions or thoughts? Well, Jennifer and Rose, thank you so much to you and your entire department. I think, we didn't see everything from where we sit. We heard a lot, though, from Mike often about all the work that was going on, and we are just eternally grateful for everything that you've done. It's been an incredibly difficult couple of years in so many different ways, and we really appreciate all the work that you do at such a high level. I mean, just the consecutive years of awards over and over again, it's absolutely impressive. So thank you for doing all that you do.
Thank you.
All right, and with that, I believe we have no further business, so we will stand adjourned.